So we'll start.
Okay, sir. Yep.
And welcome to second day of this ATAL FDP. Starting with today's first session. Like yesterday, we'll be having three sessions. In the morning, there will be two sessions, then lunch followed by third session. Uh, Today, we have first session of Mr. Jitesh Doshi.
Hello.
Uh, he will be talking on embracing the database revolution. Before he starts formally, I'll introduce him. Mr. Jitesh Doshi is a bioinformatician with a master degree in bioinformatics from University of Pune. He has also completed advanced bioinformatics course from Chicago, USA. Currently, he is heading a young startup named BioInsight Solution, providing IT solution and training as well as consultancy services in field of bioinformatics as well as bio IT. He, he worked as a research bioinformatician as at Tata Memorial Center, famously known as ATRAC in Navi Mumbai. He is also continuing as a visiting researcher at that place. Before that, he was at Chicago attending courses of computer science and bioinformatics as well as uh, teaching assistant. He mainly his active area of research is machine learning in bioinformatics and computer-aided drug discovery. Along all his career path, he has pursued his passion for teaching by conducting a number of lectures and workshops at various colleges and institutes. With this brief intro, I request Mr. Jitesh Doshi to start his presentation. Thank you, sir.
Thank you. Thank you so much, sir, for such a kind introduction. I'll just share my screen and I'll start. Okay. All right. Is my screen visible, sir?
Yes, sir, it is visible. Yes, sir.
All right. Okay, so a very good morning to each and every one of you, and welcome to this session. First of all, I would really like to thank Dr. Bhavin as well as his team at Maliba, Dr. Sandesh, who has been in contact with me for arranging such an amazing workshop, which is very relevant to this time and very much important for everybody going through these kind of courses like pharmaceutical sciences as well as biological sciences and chemistry. So welcome to this particular session on embracing database revolution, overview of some of the AI-based techniques which are available for drug discovery research. So let's start and let's first get introduced to what today's session is going to be about. It's going to be very introductory and kind of review of various things rather than going into technicalities of all of it. So I have been attending this session since yesterday, and already there is a panel of such an amazing people who are well experienced in these areas, giving you a lot of insights into this particular session. So I hope you all are enjoying. And this session will be basically on overview on how and why it is important and relevant today, and how to approach this particular field going forward. especially being a part of the FDP, that is Faculty Development Program. We'll also discuss at the end how faculties can get more involved and active in this particular area, and they can encourage students also to get into this particular zone. So we'll start with some very basic introduction to the data and data sciences. Going forward with the drug discovery process overview, I think everybody, most of you coming from the pharmaceutical background, already are aware of this process. So we'll jump quickly to applications of the AI and data sciences at various stages of this drug discovery process. Going forward, we'll learn about overview of what kind of techniques are available, not very details, but at least an overview as to understand which type of problems can be solved through what kind of techniques, etc. So those are the things we'll look at. We'll also go ahead and talk about some of the important aspects like feature selection, some case studies maybe, and as and when time permits, let's go about it. So I'll start my session with a very simple thing. I think all of you at this moment, either to this particular session or anywhere from the news, already have heard about these statements. Data is all that we are talking about these days in the scientific as well as technological advances. So data is a new currency. Data is new oil or fuel. Data is new gold. So these kind of statements you will hear a lot these days. The reason is, of course, exactly valid for this reason, that it actually is something very important, and it is paving the way towards new kind of research and development that we are kind of experiencing in these days. So how does actually data fetches you any money? Why we're talking it in terms of currency, first of all? So let me just give you some brief example as to how does this data help. Now these examples are from not from our pharmaceutical or biological domain, but at least they will make sense going forward. So there are many kinds of activities that we do online today, and as you know, every click that you do, every page you visit online, everything that you do is properly monitored and tracked with a lot of activity trackers all across the globe. And we are not going to discuss this any of the bad sense. We are not going to talk about negatives, because we want to take this forward as a positive support and come up with some useful solutions for our drug discovery projects. So one more thing before we go ahead, along the line, if you feel that there is something that needs to be discussed, explained, or elaborated, please feel free to do so in between, or you can keep your questions written down for the end as well. Intermittently, I'll just go through chat in case there is some important or relevant questions, and I'll address that before going forward. So, as we're talking about how and what kind of activities can be done in order to get usefulness out of these data. So, consumer insights is something very important, and we all are consumers of some or the other product, commodity, or services in our daily lives. And what we do can give a lot of insights to the producers, to the manufacturers, to the advertisers, in order to get you to the right path and give you the right directions or target you with the correct relevant information. So these are all the things which make it very useful sciences, because they can fetch you very useful qualities like money. Of course, if you are into that zone as an end user, it provides you with very kind of personalized services. So going ahead, personalized services are something very important and very useful. Then there are recommendations which are always very like popping up always all the time. So all of these things are quite interlinked. Like for example, when you go to Facebook, what kind of content you like, what content you share, all of this is tracked in order to generate relevant set of features that can help you get more newsfeed which is relevant to you. When you go to Google of course tracks every part of your activity. So for example, what kind of restaurants you visit, what kind of places you usually go to, at what time of the day you like to kind of wake up and get up with your phone, or any of such thing. Everything is properly tracked, and that is used to further enhance the user experience in every field. Similarly, when you talk about recommendations, very important systems of our day to day. So for example, whenever you go to Amazon and try to search something, you will see that similar kind of ads will come up with your webs for a longer time. Also, when you try to buy some product, just below the product you will get an uh, feature or kind of suggestion that okay, this product usually is bought with these two. So they suggest you of course that these could be helpful along with this product, as well as they get more sales, because more often or not we will think okay, this might be an important addition, so let's buy it. It's not something more, so we can buy it. So that way the sales can also be so it works both ways. And these recommendation systems are also again based on the data science. More data we generate, more data we have, better models we can build for any of these things. All the times money is not directly visible in these scenarios, but rather sometimes it is coming as two important aspects: the cost reduction and time effectiveness. So in a lot of processes, the cost which goes into producing those stuff is reduced through optimization, through many other things, as well as because of the automation, the time effectiveness is there. So these two properties are going to be very important for our drug discovery discussions. And of course, this letter gives the behavioral insights to the companies about how do we behave, what kind of things we go about, and what they will try to predict how you will behave in future, depending on your past experiences. So these are kind of an industrial or technological or digital aspects of all our life that we are already experiencing. Not just being digital, but even if you go to a supermarket or a mall, your activities, your purchases, everything is tracked so as to gather more and more data. And this data ultimately is used in a lot of different forms and factors to generate more revenue, as well as to help customers getting better recommendations for their future purchases. So this is how this particular entire ecosystem is built on, and everything that we do today can contribute towards data. We'll discuss what this data is and where does it come from, but let's go ahead step by step. So now we can ask a very simple question. If these companies are using our behavior, our activities to model it, our behavior or whatever, and then make money, why can't we at least think about using the behavior of various biological systems and activities of molecules of like drugs, for example, to create better drugs? That's a very simple thing. So if already there are things existing for that, and we know that these kind of activities can also be tracked for the drugs and other molecules, why not to use it? So basically what I'm trying to say here is that, all right, so when you are going online or shopping, your behavior is being tracked, that at what time of the day you go for what kind of searches, what time of the month you usually go for more amount of shopping. So all those things are tracked by these companies in order to get better at their sales and your recommendation. Similarly, every type of your activity that you do online, your searches, your voice searches, your location history, your clicks on every part of the internet, everything is being tracked, so that in all this ecosystem can develop further and help both consumers as well as the companies who are doing it. Of course, there are a lot of drawbacks and as well as ethical concerns regarding this, and more often or not these things benefit the companies rather than the end user. But anyways, we will not be focusing on that part right now, because we want to try and use this similar kind of system for a betterment of society, that is the good drug health, drug discovery. So similarly, now when you talk about the behavior of various biological systems, through experiments of long for large amount of time, we have been doing a lot of experiments about drug responses, the behavior of cells when the drug is incorporated, the concentration of drug which changes over time, and a lot of other things that we can see. So for example, here it could be two different types of cells, one normal cells and one cancer cells, to see how does the basically dose of the drug behaves and cells behave in response to that. Similarly, the activity of any drug, which we usually measure as its affinity or binding towards a certain biological target. So if we can keep track of all those things and model them into some sustainable as well as viable model, it will definitely help us in creating a better healthcare. Not completely, but at least in some way it will give us right direction in order to go ahead and produce the better quality drugs. Now, are these data-based insights really new? Why we are talking about them right now? Well, of course not. These are not new. Yesterday, when I was just trying to create this slide, I was just thinking about what could be the simplest type of experimentation I might have done in recent past, or maybe a little bit farther, that could be just an example of data science. And I was just remembering my bachelor's days, where we used to do protein concentration assays, identification assays, drawing these simple graphs on paper, trying to by hand fit this line by pencil and scale on the graph paper, and then try to extrapolate something. Well, it was a kind of data science. This graph was our model, and whatever values we wanted, we would predicted by using extrapolation. It was a simplistic model, but yes, it was still data science in some sense. Then cell counting, we have used hemocytometers at some point to use or count the number of cells in a given sample. Of course, we cannot measure each and every cell in the given sample. What we rather do, we divide into these different quadrants, measure in each of the quadrant, and then extrapolate that if this is the dilution factor, then what would be the number of cells over my total thing. So it is again a kind of relationship between these numbers and the total dilution that you have to find the final number. And of course, being from a pharmaceutical background, many of you have already done QSAR at some point, learned QSAR at some point, because it's been there for a really long time. And QSAR is a very prime example of how data science has been there for a really long time. The thing that has changed currently is that the form in which these studies are now presented and done, the scale at which these things are produced and done, and how much of manual intervention really do we have to put. So the way that we look at it now, we have more of a programmatic as well as accessible software and hardware to do this scale. Now we're talking about literally hexascale, pentascale data, which is really huge amount of data that we play around with at the same time. And most of these processes are rather automated. This fitting and everything is done directly by the software. So in these things, of course, it has changed tremendously, and that's why it has led to the formation of one specific stream called data science. We'll talk about that as well. So going forward, let's just get some of the terminologies out of the way. Let's understand what these commonly heard terms really mean and how they can be different. Many of you may already know about this, so I will very briefly go about it. But then some of you which are very new to this field, that's what I'm assuming, may have some confusion about these terminologies. First of all, everything is here revolving around data. So what does data really mean? This data can be anything. It can be any raw information that you have produced. It can be any observable that you have produced in the laboratory as a result of some experiment. It can be record of any activity or property of certain aspect object, or it can be any variable that you would like to study further and its relationship with other variables. So data literally can be anything. Everything that you do on a daily basis can be your data. And data science is basically a newly emerging science which deals with processing, analysis of data, and reporting of insights which are gained from this data. The ultimate aim of any of these process is to analyze the data. So data is there that we analyze in order to produce information. This information we then interpret in order to get knowledge out of it. Once we have the knowledge, that knowledge we try to apply for betterment of our life systems or any other part of our daily life. So data science essentially has helped us centralize all those techniques that we have been studied for a long time into some well formatted, well formulated science with a set pipeline. So that's why data science has been a kind of emerging as a very new trend in every aspect of our life. To just precisely define what it actually contains, data science is actually a mixture of various things. Primarily, the statistical methods which can deal with the data and understand data, explore it, and analyze it. I think yesterday we had a session on the pre-processing and post-processing of data, where you might have learned many of these techniques. Computer science, which help us kind of provide necessary tools like the programming languages, the algorithms, the hardware to run such a huge amount of computation. So that is a very integral part of this. And of course, the domain knowledge. So domain knowledge is basically a variable in this case, because that keeps on changing from which domain you are from. So for example, from a chemical sciences, you may deal with just chemical structures. From biological sciences, your information or data may be some about biological systems. If you're from a financial sector, your data can be about some financial transactions or stock market or etc. If you're from let's say transportation domain, it will be a network of roads and highways and how do we optimize that. If you're from a background of let's say logistics and supply chain, then that will be your data. So every package that goes and leaves the place, where does it go, how much it travels, how much cost we have to put, that can be your point of data. All of this data is then collected and then processed to provide more insights into how the data is behaving, and based on that behavior you can then estimate or predict some more aspects going forward. So that's what these data and data science actually are. More terms that you would hear very commonly in this area are artificial intelligence, machine learning, and deep learning. More or less, these are at some point they're overlapping. They have some commonalities, but they have their specific definitions which set them apart. Artificial intelligence, as the name suggests, is a field which tries or aims to provide intelligence to machines or create an artificial intelligence which can make decisions, which can think, which will basically have a reasoning just like we humans do. Of course, it all started with a kind of dream and passion or ambition of creating robots or creating an intelligent machines which can think like us. But again, we are not yet at that point completely. But then these processes, these techniques have developed and extract like kind of expanded over many other domains of our life and making them better. Machine learning, when you hear this, these are basically nothing but a set of tools or techniques which are especially statistical learning techniques which are used. This is one of the toolkit or one of the equipment that you need to achieve the goals of AI. So machine learning, we basically show a lot of data to the machine through various segments and various kinds of processing and ask machine to learn about this data, find patterns in the data. So pattern recognition is a very important keyword binding all of these together. So machine learning are those techniques. Deep learning is basically a subset of machine learning techniques which are based on something that we call as neural networks. These deep learning techniques, they try to utilize or exploit the nature of our brain, the way it works, the way it behaves. So neurons are basically kind of copied or mimicked into these deep learning methodologies to create a deeper and deeper network of various features together to come up with the best quality model. So we'll talk about machine learning and deep learning a little bit more forward. So these are the terminologies that you may hear commonly around these data science related aspects. Now, first thing when it comes to mind when you hear about, okay, artificial intelligence seems something interesting. Can really it solve all our problems? Of course, as you would expect, the answer is definitely no. Even for a simplest task today, AI can definitely fail at points. And of course, some of the tasks that it has mastered so well that there is no doubt that it will master any other task as well. So basically, this all is a concept of modeling which expands our understanding of certain aspects, which simplifies our observations into a mathematical model. So your model that you generate through this technique is as good as your data. If you have enough and good quality data about certain problem that you want to solve, you may be able to do so. Your model is as good as your understanding of the phenomenon. So if you yourself don't understand your problem very well, or the concept or the phenomenon or the domain behind it, it will be difficult to come up with a good quality model. Your model is as good as your representation of the problem. How well you are trying to represent your problem in a computationally understandable manner, that's what matters a lot here. So yes, all of the problems cannot be solved. So for example, when you talk about speech recognition, handwriting recognition, AI has gone at par. I mean, anything that you talk to your computer, as long as it is in a said language, it will easily understand that. No matter what accent, what part of the word you are from, it will automatically understand what you're trying to say. When you write something or scribble something, no matter what kind of handwriting do you have, good, bad, or not understandable, AI will still be able to understand better part of it through its recognition system. But there are some tasks that AI has not yet mastered. A simple image recognition, yes, it works very well, but sometimes even with the smallest similar kind of images, AI can make a uh, confusion that can happen. So there are certain problems which can be solved, certain which are on the verge of being solved, and certain which definitely cannot be solved through AI. So we'll talk about these limitations at the end. Now we are talking about this is all in relation to the drug discovery. So what is this drug discovery problem first of all, and how it relates to the AI or data science or data discovery? Drug discovery, as all of you know, I'm assuming here that all of you are from the pharmaceutical background, so already know a better deal than me about the drug discovery. But just to kind of summarize, drug discovery is a multi-parameter optimization problem. That means at the same time, we are looking for so many different parameters, so many different tasks to be fulfilled in order to get better drugs. That's what the problem is. So when you're talking about drug discovery, we're trying to look or find a molecule which will have many different types of properties in the desired ranges. These are just some that I have listed. The molecule should have activity, a molecule should have good ADME properties, a molecule should not have any side effects, it should have good solubility and permeability, and many more. There are n number of different tests that we have to carry out for a molecule to be drug likely. So this is a very multi-parameter optimization problem where we have so many variables, so many different parameters that we need to optimize, and all of them need to be in the correct fashion to be able to take that molecule forward as a drug. When you look at the drug discovery process, I'm sure all of you are aware of this drug discovery funnel and the process which goes behind it. So I will not be spending too much time on this. Very briefly, I'll just quickly review this. So it all starts with the basic understanding of the disease. You understand what kind of disease you're tackling, what it actually means, how does it cause, and a lot of other basic research, which is often open-ended. We don't know how much time it will really take to understand the disease. The next stage is the lead discovery stage, where we try to find the potential compounds or chemicals which can be used for a drug discovery research. Furthermore, we optimize some of those selected molecules so that they will be best suited for the further stages. Going ahead, we go to the preclinical trials, cell-based studies, animal-based studies, and then we go to the actual clinical trials, which the development phase actually starts. So the phase 1, phase 2, phase 3 clinical trials, finally to get one compound approved by the regulatory authorities to be used in the market or produced as a drug. And then even after that, your drug discovery doesn't really end, or the development doesn't really end. So these initial stages of drug discovery are often collectively referred to as the discovery research, and these phases are called as the development research. Now, as you would see, more commonly, these drug discovery or lead discovery starts with a huge number of molecules. And on an average, a pharmaceutical company has a size of 10 raised to 6 millions of actually molecules are what we start with. And ultimately, our aim is to short down till we find this one good molecule which is best in every fashion. So that is what this drug discovery funnel is, and that's huge amount of efforts, time, and money which goes into this entire process in selecting those. So to kind of support this particular studies, computer aided drug discovery came on, and it's been there for some time, which is nothing but a collection of computer based tools and techniques which assist us in various stages of drug discovery process. So computer aided drug discovery was kind of developed by many people from many fields into kind of a very good set of tools and techniques which are even today used very commonly in drug discovery. The aim of the CAD was to reduce the cost and time which goes into the drug discovery. So of course, one of the main important tasks was, if you have so many molecules at the start, is there any way to filter those molecules or screen those molecules based on some properties before you actually purchase them or synthesize them in the laboratory? So that's what the virtual screening came from. And there were many other things, of course, in this particular scenario. And the approach which you often see in most of these techniques is the modeling and estimation. Either you model some kind of a property or some kind of an activity by yourself, or at every step you're using a model which is generated or developed by someone else. So that is the central part to any of these techniques that we use. Essentially, if you have to define, the CAD basically is made up of two separate parts, or two major fields play a role. Of course, there is a many other fields involved. It's a very interdisciplinary subject. So first part is bioinformatics, which essentially deals with understanding the biological system, the genes, the proteins, etc. The chemoinformatics, which deals with the chemical system, understanding the molecules, their properties, their feasibility, etc. And at the CAD, there is an interface. CAD is at the interface of these two, where we understand the interactions between the biological system and chemical system. That's what the CAD actually does. So earlier we talked about these phases: basic research, discovery, and optimization. So the target discovery or the biological origin of the disease is discussed in the biological or bioinformatics part. and the lead discovery and optimization is discussed in the cheminformatics part. Informatics is again just like, very similar to data science. As before this data science came as a separate field, we had this informatics field for various things. So when we say bioinformatics, essentially we are applying the statistical techniques and computational algorithms for biological system analysis, and same goes for cheminformatics for chemical systems. So that's where this CAD came into picture. Now, one of the most common approach of the CAD is structure-based drug discovery, and we will discuss the use of AI at various stages of this. Now, there are many ways or many approaches in the CAD which are taken depending on the information at hand. So we have structure-based drug discovery, which we'll just go through. We have ligand-based drug discovery, we have fragment-based drug discovery, and integrations of these techniques. So structure-based drug discovery in the CAD is basically also referred to as the target-based drug discovery. It's a multi-stage, very interdisciplinary process and extremely complex. It requires input from many different types of disciplines. Most of these stages are data-driven in the computer-aided drug discovery and based on some kind of a model. And the role of AI is improving these models for better accuracy and better efficiency. So AI is now being integrated at many of these stages. Earlier models were there, but they are now been replaced one by one into more appropriate AI or deep learning based models into coming things. AI has applications in, of course, many domains. It has applications in discovery, it has applications in development, it has applications in post development tracking, in the management, in the general workaround of the logistics, as well as production optimization, and many. But I will be focusing only on the discovery part because that's the area where I work in. So I may not be able to like detail tell you about other parts. So let's very quickly go through the list of stages that are present in the structure-based drug discovery. Again, I'm sure that many of you already know about this, but if somebody has any questions about any one of this, definitely you can ask. So the drug discovery starts with the disease selection. It's a very important aspect that which disease to work on, and it depends on a lot of factors. If you are from a government institute funded by government, of course you would think about the diseases which are socio-economically important. If you're from a pharmaceutical company, you would rather think about the market, the input and output ratio, and challenges involved, and many other things. Once you identify the disease, you go and identify the mechanism of the disease. You identify how and why the disease is propagated, which molecules are responsible, if there are any, what is the mechanism through which it happens, can it be modulated, etc. So this identification stage will give you certain specific biological target to work on for your pharmaceutical intervention. The target structure determination is basically the requirement for structure based drug discovery, wherein a three-dimensional chemical structure of your biomolecule is required to go forward in this process. So this is the biological aspect of the disease. The next two stages are the chemical aspect, wherein you start collecting a large number of chemicals and generate your initial library. Now this library generation is of course multifold and happens in many ways. So what we are exactly trying to do here is that we already have defined a problem. Okay, our problem definition is that give me a molecule which has good ADME, which does not cause toxicity, and which binds to the target or molecule in a much more efficiency or with great affinity. So all of these constants we are given as a problem statement. So where to find the solution? If that is the problem we have.
STTP STTP નું કરી દઈએ એટલા માટે.
Oh, someone has a question or
Sir,
something?
sir, no, sir. She has
Okay.
unmuted. I have muted her.
Okay, okay. Thank you, sir. Thank you. All right. Yeah. So basically, the problem statement, we definitely know that, okay, I want a molecule with these list of properties. But where to find the solution? Where can we get such answer? Where can we get such molecule? And the answer for that is a chemical search space. There is a concept of abstract chemical search space, which is basically a space, hypothetical space, which is covered by all possible chemical structures, known as well as unknown. So if we could explore this chemical search space or chemical universe, we would be able to find some chemicals which meet our criteria. Some of the known chemical parts of the search space are these: the natural compounds, the databases of various synthetic compounds which are available, and going forward we can generate some related compounds through combinatorial library design. But apart from this, also there is a huge chemical structure universe which is still unexplored or unseen. Can we look into that? And that practically is infinite. So what are the ways to pinpoint to a specific spot or get the hotspot in right? So these some of the answers may be given, some of the questions may be answered by AI going forward, as we'll discuss. Once we have this large amount of chemical library to start with, of course all of them we cannot work around with in experiment, being costly and time consuming, and the aim is of course to reduce both of those things. So we submit these things to a virtual screening. Virtual screening is, of course, the screening in virtual space, that is in silico or on a computer, in which we screen the compounds based on many different things. The drug likeness properties, like for example, Lipinski's rule, and many other rules are there. Then properties which are important for absorption, distribution, metabolism, and excretion. Models which can tell us about the potential toxicity of known kind. So these are some of the things which we can do in the virtual screening and find the molecules with good potential for drug likeness or good ADME properties. Going forward, we can expand our perimeter of this search and try to narrow down forward by using the molecular docking. So this phase, the target lead structure determination or structure based screening rather, it's basically a phase where you are going to discuss or discard large number of compounds based on their activity against the target. This activity is measured as a function of the molecular interactions and interatomic forces of attractions which are present between the molecule of your interest and the target that you have decided. So this phase will again discard a large number of molecules. And still this being in there for a long time, and still many of these processes have a lot of limitations. The rate of false positives as well as false negatives both is very high in these processes. Going forward, the selected molecules from this can be then synthesized or purchased, studied, validated. If they are not having the activity of your interest or that you expect, you can come back, optimize them. After optimization, check them again. So this process will go on for a certain amount of time till you find the best molecule, which you will then subject to the further testing for viability or clinical trials and other things. So this is a usual workflow of a structure-based drug discovery in short. Now, where does AI comes into picture? So to understand where and how AI can help, let's take a very simple or small analogy. Now, all of us have studied the lock and key model of enzyme action at some point. It was one of the very like pioneering or very initial kind of model to describe the enzyme function, enzyme substrate interaction. The enzyme would be a lock and the substrate would be a key. They would fit into each other only if they have some kind of complementarity. So let's extend this kind of analogy a little bit further. Let's start from the disease. Let's say that the diseases are various kinds of doors which are there. Now you can decide based on the criteria we discussed before which door you want to actually open. So that can depend on many things. Then each of this door will have a specific lock with which you would be able to open that door, which are targets in our case. It can be a protein, it can be a gene. That's what we are looking for. And the key is basically a small molecule which will be able to open that particular door. Now with this, there can be different problems solved in different ways by AI. The first problem itself could be finding the locks for new doors. Now you have a plethora of doors, then what kind of lock it is? How do we find the lock for that particular door? That is the first thing. So that is the target identification. In this, AI can help us a great deal in identifying several kinds of targets for various diseases, which we'll be discussing going forward. Now to open that door, once we understand what is the lock made up of or how does the lock look like, then the next part is to find the potential key. Now there are two ways by which we can do that. Either we can collect all the available keys in the market and try them one by one to see which one actually fits and opens the lock. So that might take some time to go through all of them, and it may so happen that you will not actually get any key that can open that particular lock. So the second approach is designing a perfect key. That could be another approach. So for example, I'm sure that at some point in your life you definitely have come across a situation where you have lost your key or misplaced your key or have been locked out. At least I have been at least some few times. So whenever you call a locksmith to get a new key for the door, what they do, they insert some equipment into the lock, they study the lock one by one, little by little, and then they create a key which will perfectly fit into the lock and it will open it. So can we design such key for our locks? That means, can we design the molecules for our locks? Can we do that? That can be another approach. So that's where AI can be very helpful in designing, because there are multiple combinations, there are huge amount of possibilities for designing new key. So we cannot manually explore all of them. Can we ask AI to do that? Yes, we can. Then once we find a potential key, it will be a rough, it needs to be polished, it need to be kind of fine tuned in order to fit perfectly and very smoothly. So that is where the optimization comes into picture. Once we find a kind of somewhat working key, we need to make it much more perfect through optimization. And then these optimized keys that you are, then you can try it on your final doors and see which optimized keys actually can work perfectly fine for this. So the same way in this enzyme world or realm, we can apply AI at different. We can apply it at the target identification phase to find out which locks are there for a particular door, which type of lock. Then in the initial screening, it can help us very quickly go through all the locks. So rather than uh, picking up a key and putting to the door, can we just look at the key shape wise and see which one will probably be able to fit? That's how we will screen, right, in our terms. Similarly, can AI look into some of the important properties and filter some of the keys beforehand? That's what the screening is. Then designing this key or de novo synthesis means what atoms, what subset, what functional group to take into account, because there are so many possibilities. So AI will be able to find you this new lead compounds through de novo design. Of course, humans are very important in every aspect. It's not a solely AI's responsibility or job to do it. It still cannot do it, it's very nascent, but it can augment our capabilities definitely by using these techniques. And finally, in optimization, again, there are numerous possibilities to optimize. So how it can help, those are the some of the things we will discuss in this particular scenario. So now that we have seen two things individually, the data science related terminologies and the drug discovery related terminologies, let's look at how do we generally approach any problem through AI. Now this list of stages is absolutely not exclusive, there can be many variations into this, but some common approaches which are utilized in these different stages, that's what I will discuss, and their relevant example from our drug discovery pipeline. So the first, we start, whenever you want to use AI for any kind of problem solving, first we need to state the problem. We need to find the problem and state it appropriately with complete definition of that. So for example, is the problem could be, is this protein that I'm using is druggable, or can this disease be cured? Is there a possibility of knowing a molecule? So any of these superficial or kind of vague statements can be your starting problem. Then you can break them down into smaller pieces. The next stage logically is of course data collection. If you want to create a model or you want to show AI how to learn about something, you have to show a lot of data. So data is of prime importance here, because that is how the AI is going to learn about certain aspect of your problem. So there is good data, bad data, there are ways to pre-process, filter, etc, of course. So collect that data. So for example, if you're modeling certain activity, then how many known molecules are available for certain activity? Are they enough to create a very effective model? So those are the questions you need to answer while data collection, and start collecting the required data. Then comes the pre-processing of data, where you do a lot of cleaning and exploratory data analysis in order to find some basic aspect or characteristic. Of course, at this point, you have to remember something, that you have to always split the data into two, the training and testing data. But again, we'll come to those terminologies little later. That's why I've just kept it as a sub point. Once you have this data, if you're using a machine learning approach, then you need to do something that calls a feature extraction. Feature extraction is nothing but what actually matters about that. How do we represent this particular data point to the computer? So for example, if you want to again go for property estimation of certain molecules, then which properties of a molecule, which features of the molecule will be important for that activity or that property, those we need to include in the data set that you're preparing. Then choosing the appropriate method, it again will based on what kind of data you have and your objectives. So there are many methods in this area, so you need to focus on a specific ones which can help you better. So you can look at the data. Is the data having any apparent distribution, or is there kind of, is the structured data is there, or the data is unstructured? Are there any labels available? Can we use this to uh, train the model more efficiently? So these things can be discussed here. After you do that, you train your model. Of course, you actually perform the training experiment. That means you show this data to a computer, the software will learn from this data and devise a policy or devise a kind of model or equation that can represent your data entirely. So again, once you train the model, what kind of model will work, which is the good model and all that will check. Then we will evaluate it. Of course, we need to find out how well the data is fit by the model, how well it is able to work on the unknown data. So evaluation and testing is of utmost importance. Finally, once you're satisfied, you publish the model, and that is used by people. Then so in this case, basically, what kind of errors, how much is the error, is this error acceptable in my scenario? So for example, if you're doing some initial screening, it's okay, you can accept some of the errors and go ahead with filter compounds. But if you are using AI to assign clinical trials or do drug response modeling, can we afford any big errors? Of course not. So based on that, you can change your threshold of error and go ahead with the models. Then you can test these models on some set aside compound that we call as this test compound, and see whether the model is able to work on the kind of unknown compounds or not. So basically, when we train on certain models or certain molecules, of course for those molecules the model has already learned a great deal. So when you use the same molecules again to test, it will always give you a very good accuracy because it already has seen that model while training. But when an unknown compound comes, that's where the real test of your model is, to find out whether for the unknown compound as well it is able to predict the properties or activities accurately or not. So that way you estimate this or evaluate the model and then publish it further. Now we will not be discussing all of this step. Of course, during this entire course there are very useful and much more detailed session on specific types of these stages, which will be very helpful for you, but this is just an overview of those stages. So when we say that there are so many models, so many things, what kind of models are there? What are the different classifications? How can they be used? So I will very briefly go over those things. So we have seen that AI is kind of the main concept here. It's any technique which enables computers to mimic human brain. That's what the AI actually is. If we restrict the applications to healthcare, within healthcare also there are so many applications. We can use AI in research, in wearable technologies, for as a sensors and keeping track of our activities, in drug discovery, which we are discussing right now, in virtual assistant. You have the doc apps and everything in which you can discuss your symptoms and see potential diseases, patient data and risk analysis, hospital management, mental health, surgeries. Today you know that many robots are also doing these surgeries, in lifestyle analysis and changes, digital health monitoring. So all of this AI is a very important part. You may see today there are so many AI based apps on your mobile for fitness tracking, for teaching you some training sessions, and many things. And all of these are based on some or the other kind of AI technique or intelligence. The techniques which are used, or technology which or basically the tools which enable these things, are machine learning. So there are many types of machine learning approaches available, like supervised learning, unsupervised learning, reinforcement learning. I'll tell you about example, and I'll tell you what actually it means. So in supervised learning, again we have classification problems and regression problems. In unsupervised, we have clustering and feature finding. In reinforcement learning, we have decision making and execution. So we'll talk about these with some examples. And then comes the deep learning, which is one of the technique of machine learning, but it has a little bit different approach, and there are slight differences in which these two techniques actually work. So when we say that some of the techniques are supervised learning, why it is important to know is, when you are devising a problem, you should know which type of data it is, so you which type of technique will be able to work on. So supervised learning is nothing but learning with data or learning with labels. So in this technique, what happens, whatever data we provide to the computer, we label it. Like we tell computer, okay, this data point means this data point means this, etc. So these are called as labels. And by utilizing these labels, computer can learn to differentiate between different labels and then create the model. So in this, there are two major types of tasks: the classification task and a regression task. Classification, as the name suggests, means classifying the data or dividing the data into discrete number of classes. There can be 2, 3, 4, 5 different classes in which our data is divided. So what happens, once you create a model based on these classes of data, the new data will be labeled according to its resemblance or relatedness to one of these classes that we have. On the other hand, regression is basically, there are no specific classes, but every data point is presented with a continuous value, so it can have its own value without any specific classes. We will take example of both of these. So when the new data actually is given for prediction, it will actually predict the value directly of that particular be it molecule or any other new data, rather than predicting what class it would belong to. Both of these are utilized in different ways. So for example, let's take the example of classification. Let's say we are trying to develop an AI model for prediction of kinase inhibitor. So basically, what our problem is, given a molecule, our model should be able to predict whether this molecule will be inhibiting kinase or not. It could be any kind of kinase. So what will be our data for that? We will basically generate a list of kinase inhibitors. Of course, that will be our first data, but that is not enough. We also have to show it a negative data or data which does not belong to the class. So that's where it will be able to differentiate. So the another data we can give is, let's say, kinase activators. Third data can be kinase substrates, anything. So let's say we just have two sets of data. One contains molecules which are kinase inhibitors, and another set contains kinase activators. So when you have such kind of data where we can give these labels, this is called as a label. Kinase activator, kinase inhibitor is a label given to each one of this particular molecule. So when you have such kind of data, you can use the classification technique or supervised learning classification. This data will then be given to a model will be trained on these data sets, and then the model will be ready for final use. So when an unknown compound comes, we submit this compound to the model, and model will predict whether this molecule belongs to kinase inhibitor or kinase activators. So it will label the new molecule with a specific class. So this is a simple example of a classification task. So if you have such kind of data, you go for the classification approach. Now, what is the regression approach? What is the regression basically? So let's take an example. Regression, as I told you, when you have a point of specific value, individual value for each of the data point, which is continuous, and it does not have a discrete classes or numbers. So for example, let's take a very simple way, predicting log p of a compound. Now, log p or partition coefficient is a very important aspect of drug discovery. We always need to find out. Though there are so many models already, we will always need more and more accurate models for such activities. So, for example, log p prediction. Now, log p cannot be just classified into individual classes. It will be a different value for each compound based on its structure. So let's say you have a list of these molecules, and all of them have these kind of values of log p experimentally calculated. So in this, of course, you cannot create classes like this. You cannot classify the data into 2 or 3 or 4 discrete classes, because these can be literally any number, and each will be very different from each other. So in such cases, you will go for the regression technique. So this is called as a regression task. So you will submit this data to the supervised model, which can handle the regression. The model will then be created for application. And when a new compound comes, rather than just predicting, okay, it will have a high log p, low log p, moderate log p, rather than that, it will actually show you the value. It will predict log p of this compound will be this much. So this is the regression task. So such kind of data should be given for regression task. Now comes the unsupervised learning. That means we do not have a supervision. We do not have any labels or kind of points for which data can be classified. So in these classes, usually this is often also, you can see, referred to as unstructured data. There is no specific structure into the data. It's just there collected from certain things. So it does not mean that we cannot use these techniques for that. We can still do that. So one of the techniques used in unsupervised learning is clustering. Again, clustering, there are so many different types of clustering, but let's not worry about them right now. Essentially, what the clusterings will do, they will group the data together based on their based on a given metric or some similar properties that they may share. So metric can be any common feature that you can use, any statistical linkages, averages, or mean, median, mode, whatever you want to use can be used, or some kind of geometrical distances can also be utilized. And there are many other matrices to classify this into specific. So the thing here is, you have a collection of data points, you have a collection of molecules, but you don't have specific class or specific value that they belong to. You just have the set of molecules and you want to find a relationship between them. So in this, what we can do in unsupervised learning, we can in fact discover new relationships and we can create new groups which we can assign to different data points. These smaller clusters in which this data are classified, they are actually usually the ones which share the similarities with respect to whatever features that we have utilized. And they can help discover new classes of molecules as well. So to understand this, let's take a very simple example. Earlier, we were trying to classify this into molecules into kinase activators or inhibitors. So it was with respect to the kinase. But within the class of within the set of these inhibitors, can we find some properties? Can we find some shared phenomenon? So let's say we have collected a lot of kinase inhibitors, and we don't want to worry about kinase protein right now, but within the given set, are there any similarities or differences within this? So to classify this data into several things, we can use the unsupervised learning. So what unsupervised learning will do, it will take all these structures that you have in this data set, and by studying them and their interrelatedness, it will create different types of classes based on their similarities. So then you can label them as per requirement. So this is for example, you can say this is a class 1 inhibitors, this is class 2 inhibitors, this is class 3. Or if you know what properties are common, you can label them accordingly. This way, the unsupervised learning can help you classify the data without knowing the labels of those data. It can extract the labels, new labels it can discover from the given data and its parameters. The third type of learning, the machine learning, is reinforcement learning, which is very much different from all of this. It's something very interesting. It's a very different beast altogether. And it's actually something we can see happening or being useful at many places. So in reinforcement learning, what actually happens, we create a computational agent per se, and we allow it to explore a certain given environment. Then it performs different actions. That agent performs many actions in the given environment that we have simulated on a computer. And based on the actions performed by the agent, either the system gives it rewards or penalties based on whatever function that we have decided. Now, the way it gains more and more rewards, the agent makes its own policy regarding whatever action it is doing. And the policy will be updated for a really long time in the number of generations or till it is completely optimized. And this policy will be your final model of something. Let's take a very simple example. I mean, before we go to the molecular example, so you may have heard about self-driving cars. They are not yet the complete reality, but they are already on roads and working fine, at least in a limited number of cities in US and other places. So they have been trained with something, of course, a mixture of reinforcement learning and many other types of learning. So what has happened, before that car was on road, it was subjected to the simulated road environment. There was simulated cars, simulated people, animals crossing, signals, everything. So car was asked to just drive on its own into the simulated environment. So car would go, if it kind of hits someone, then it will get a very negative score. Then car would be our agent basically in this case. If it stops at the signal, then it will get a positive score. So all of these experience, of course, these are millions and millions and millions of cycles of these go on parallelly at the same time. And that's why the more hardware has been relevant. In fact, availability and accessibility of this more potent hardware is what has made these things possible and accessible now. That's why deep learning has again resurfaced as a very important technique to be used. So in this, this is a kind of exploratory environment where we, rather than showing the data, the software itself, the algorithm itself creates the data and learns from it. It's something like that. So there is one type of reinforcement learning called GAN, or the generalized or adversarial network. So generative adversarial network, that we'll just see an example of. So just to take an example, how would it work in our scenario? Let's take a problem where we want to generate new compounds or novel compounds for a given inhibitor without giving any information. Okay, we may have some basic information. So in this case, the terms that we have seen here of the model are like this. The agent will be some scaffold. It can be even single atom also. It doesn't have to be like this that I have shown in the diagram. It can be single atom also. So initially, whatever our agent is, to just start with the basic score, let's say we are using the cost function here as affinity of the molecule towards the enzyme. So we can quickly run a docking in the background, and whatever affinities, we can give it a score. The action here can be anything. So molecule has three possible actions. The agent has three possible actions it can perform. It can either add atom to itself, it can either remove atom from itself, or it can replace one of the atom from itself. So these are the only three possible actions it is allowed to perform. Now we will run or allow this to explore the environment. Our environment here is basically made up of a chemical search space, or different atoms are there in the vicinity. The cost function is affinity. If the affinity increases whenever it does some action, we will of course check the docking score. And if the affinity increases, we will reward the agent. If affinity decreases, we will give a penalty to the agent. So agent slowly learns about these forms. So for example, in this scenario, let's say both of these techniques, it increased the affinity, so it has been rewarded. In one of these things, it was reducing the affinity, so it was penalized. In this case, it was rewarded because it was increasing the affinity. Same here. So now what will happen after some cases, for example, it will automatically learn that adding oxygen basically penalizes me, so I will not never add oxygen again. So these kind of small learning automatically agent gains by going over a large number of different cycles of populations and generations together, till it finalized the finalized form or finalized kind of molecule is achieved. So this is how the reinforcement learning works. It has been used for generating these compounds. It has been used for protein folding, prediction of protein folding, and many other problems in biology as well. So these are some of the techniques which are available. Depending on your problems, you can select an appropriate technique to go ahead with. Whenever you're doing the machine learning, as I told you earlier, the feature selection is something very important. I'm not going to talk anything technical today right now, assuming that all of you are not aware of this in detail. So feature selection means that identifying those characteristics, identifying those features which are more important for the given problem statement. For any kind of modeling you take into account, it's extremely important to use appropriate set of features. You may have already learned about this, because I assume that most of you have learned about the QSAR at some point. And in QSAR, we use these molecular descriptors, which are nothing but the features of the model. And you know that there are some set of descriptors, like for example, ChemDes, RDKit descriptors. We have the PIDAL descriptors. There are so many. So we use those set descriptors and try to figure out what kind of model it would create. Now, the thing is, though we have a lot of descriptors available, all of those or same set of descriptors or features may not be optimal for every problem. It's important to correctly identify which type of features would be more important, rather relevant to the given problem. So basically, usually for chemical systems, many kinds of electric, steric, shape-based, structure-based, quantum mechanical, topological, physical descriptors are used. And these are used in many ways: molecular representation, analysis, as well as model building like QSAR. So there are tens and thousands of descriptors such available currently. Just you look at the small subset available on ChemDes website. it has a set of 3679. It is just a few. There are many others. There are dragon descriptors, chemexon descriptors, so many other set of descriptors are there. Combined they will be tens and thousands. So it increases the basically hyperspace in which our problems are being solved. It increases the dimensionality per se of our problems, and again we have to go for dimensionality reduction and other approaches for this. Now, are all of these necessary? Of course not. For a given thing, only some will be important. Second thing, all of those which seem necessary, are they really good? Are they able to describe our systems appropriately or differentiate between our systems appropriately? That's what we have to find out. Now, there are some mathematical ways to do it. There are some methods available. So, for example, again, I'm just going to list them. We are not going to technically discuss them right now. Maybe if time permits, we can go through them. So we have methods like information gain content, which tries to find the content or information in a given uh, feature for the classification task or estimation task. Then we have mutual information content, which is related. Then we have chi-square test, which you might have already studied in your statistics. We have odds ratio, GSS coefficient, which is just kind of adapted or kind of revised chi-square test with some more coefficients, etc. So the thing what I'm trying to say here is that given a molecule, we describe a molecule through a series of features. These are electronic, steric, or any kind of features, and we give the property as a data point or data label. Now, maybe when you use this subset of features, you may have some property estimated. When you have this set of features, the prediction might go in this direction. When you have this set of features, you have maybe more appropriate or more accurate kind of estimation. So these features may be more relevant or important for this. Some features cause noise, some features are just irrelevant, some features are not able to differentiate. There are many ways of discarding the bad features. As and when you go into these techniques and learn more about applying them, you will automatically learn how to select these features. But what I want to highlight here is that as a domain expert or a person coming from a specific domain, is more important to not just blindly use these features which are available, but rather than that, by understanding the concept or the domain knowledge, engineer new features. That is what I always kind of try to focus on. Yes, there are a set features which are already there and they definitely help classify in a good way, but then there can be unknown features a space which may be relevant. Now, features are important for machine learning. For deep learning, they are not, because in deep learning, the algorithm itself identifies new features and extract them. So if you're using deep learning, it's fine. You don't have to worry about it at this level. But if you're using some set models, it's important to classify or generate your own features which may be relevant. We'll take an example later as a demonstration. We'll see how we can do that. And often if you have a limited number of compounds, it's often will be good to experimentally test some good features or some good qualities, rather than always estimating them through computers or predicting them. Then your features may be able to more appropriately classify your data into desired classes. So just going forward, I want to see how actually it is applied. I may be just showing one of the studies that we had done earlier, or and still actually is going on. So that way you may be able to relate some of the aspect. But again, this is a case study, so there may be some new things and new terminologies coming up. We'll try to explain them in the due time. So one of the important application of the AI or machine learning or data science is in target discovery. It's very difficult task to find the potential target for a given disease. Now, there are already so many approaches available, and the target discovery, which is a key process in the drug discovery entire process, or it's the main kind of thing. When you understand what the target is, you can go ahead with the drug discovery. So there are many approaches which are in combination used with each other to find the potential targets. And then again, for target validation, there are few more techniques which are available. Now, to be honest, I am not an expert in all of these experimental techniques, as I am a bioinformatician, but then I'll try to highlight some of the important ones as per my understanding. Data mining using bioinformatics is a type of machine learning in which we do data mining. It can be text mining, it can be natural language processing, in which we try to understand the literature, try to understand the text and book, and not we as such, the data mining agent or algorithm, it will try to find out the associations, and based on the associations, the mentioning, the relatedness, the relevance, it will try to find and prioritize some targets for your disease. Then we have genetic association studies, which can help us study or observe the genetic polymorphism and then find the connection of these polymorphic genes into specific diseases. Then there are expression profiling, which are very useful. So gene expression profiling basically tries to estimate or identify the expression of a gene in terms of RNA or protein levels, and then study it in various conditions to find the potential targets. I will give you example of this because this is the kind of data that we have worked on earlier. Then there are pathway and phenotypic analysis, in which the cell-based studies are done by tracking some proteins, by labeling them with dye or anything. Then we have functional screening, where we either reduce the expression or knock down the gene, or knock out it completely out of the model system, and then find out what effects does it have, does it reduce the symptoms of the disease also. So by using one or combination of these techniques, we try to find the potential targets for a given disease and then go ahead with this. The example that I'm sharing with you is basically based on the expression profile, and the problem is, will tell you about it. How does it work? So the problem of target discovery comes from this huge network. This is the metabolic network of humans. It's just actually not even complete. Just some part of it is there, but this is the entire metabolic network. Each of the dot that you're seeing is a individual protein or gene which is interacting with each other, and there are so many pathways, so many possibilities. So how can we make use of this network in order to find the potential targets for a given disease? And we can make use of this network information in multiple ways. For example, we can use it to locate the druggable proteome. Without the understanding of the disease, can we just find the potential targets which are druggable, which we can just uh, modulate with the drugs, and later we can find the relevance of those targets in some other ways, and the pathways can be studied and all. Another would be to find the target for a given disease. So if you know the disease, identifying out of these so many pathways, which pathway is actually getting affected. If this pathway is getting affected, which protein of this is actually a bottleneck protein or a hub protein. These are network biology terms. So finding out that, then which can be a potential target, modulating which will actually reduce the symptoms of the disease, and also that protein is not really involved in any other functions, so we do not have any side effects as such. So many aspects of target discovery are important, and with such a huge amount of data, it would be of course important to use some kind of computation to navigate through this entire space of proteome. And that's where AI plays a very important role, or machine learning techniques play a very important role. Then another thing could be, given a molecule, find the potential targets. So this way you have some molecules. It may be, for example, drug repurposing. For that you might be using AI for. So you have certain molecules, or you might have extracted some plant based chemicals or phytochemicals, or extracted something from a marine environment, and you want to find out whether it has any effect. You don't always have to directly go for this, but you can use certain models to predict what are the possible targets for this particular molecule that I have. So in these three distinct environments, you can basically use this network information to create more useful data. So very quickly, I'll just share some of the work that we had done, and we are currently doing like working on it actually. So we basically had a problem of identifying the targets or genes basically, which are responsible for a certain types of cancer. Now cancer, of course, is a very difficult and very complex disease to work on. There are so many complexities. The earlier methods which were there for gene selection, they used to individually target or find out essential targets, but then their interrelatedness or the network of these genes which are working together was often overlooked in some of the techniques. So we tried to solve this problem. Can we, by using some of the data? So data that we use was this, the gene expression profiling, which I'll explain in a minute what it is for those who don't know. So can we use this data and find out a set of potential genes which may be networking together to distinguish between the different types of cancer, or between the healthy person and a cancerous cancer patient? So that was the aim of this, and for which we basically use a hybrid approach. One, by using a machine learning technique called support vector machine. It is a supervised classification and regression technique, support vector machine. And CRO, which is a chemical reaction optimization, which is a mathematical optimization technique, which is a nature inspired technique. So by using a combination of these two, we could find a potential in these techniques, or hybrid techniques, to find the potential subset of genes in a given subsystem. So, just going before explaining what we did to find the potential genes which are responsible for a certain disease, let me just clear some of the terms for those who are new to this. So, chemical reaction optimization is just another nature inspired algorithm. Now, in optimization, mathematical optimization paradigm, there are so many nature inspired algorithms which closely study how the nature works and try to emulate that process in a computer by using this kind of softwares or algorithms. So CRO is one such kind of technique which tries to emulate the chemical reaction. So for example, there are genetic algorithms which tries to optimize a certain system by mimicking the genetics and evolution. There are algorithms which are called as ant colony optimization, which tries to optimize the given problem or solve the given problem by mimicking the behavior of ants. The ants, the way they behave, they move, how they together talk and communicate with each other. So by using that, we can solve certain mathematical problems. Similarly, when we look at the chemical reactions, they always try to minimize the energy and stabilize or be at the equilibrium. So by using this behavior, the way molecules work in reality, people have developed a chemical reaction optimization algorithm which tries to mimic the chemical reaction in terms of whatever problem we have. The gene expression profiling is a technique of identifying the expression profiles of all the genes in a given sample in various conditions. So these conditions can be many. So there are many techniques which can do that. For example, we have microarrays, we have RNA-seq experiments, we have SAGE or serial analysis of gene expression. So these experimental techniques like microarray, they can produce the gene expression. They basically measure the quantity of RNA for every gene under various conditions, and ultimately the expression profile that you get is basically something like this. So you have a list of genes. So we have gene 1, gene 2, gene 3 in a given sample. You have conditions. Now conditions can be, for example, time points at 0 hour, at 5 hours, at 10 hours, then under different temperatures at let's say 0 degrees, then 4 degrees, 10 degrees. So many conditions can be any. Then it can be like concentration of different drugs or molecules or nutrients, anything. So for over a large number of states, these are also called as states or conditions, the expression of individual gene is measured, and then this entire set of values, the numerical values, is called as the expression profile of this particular gene. So in gene expression profile, usually what we do in normal cases, we have the gene expression profile from a healthy person, similar expression profile is from a diseased person, and then we study or compare these two to find something that we call as a differentially expressed genes, or the genes which have a differential expression, which are significantly either overexpressed or underexpressed in the disease condition. This kind of gives you an idea of which genes may be involved in a disease, but it doesn't pinpoint the relationship within these genes. So for that, we were trying to get into the SVM or machine learning in this problem. So we use the support vector machines, which is one type of machine learning problem, to go ahead and do that. So basically what we did, the objective was very simple: find a subset of genes which is potentially a differentiating factor in a given two genes expression data sets, and which also has some given interrelatedness. So our approach was this. If somebody is interested, I will definitely explain what this CRO and everything is, but I don't think at this moment it may be relevant or important. So the solution was to go in this approach, represent the subset of genes as atoms in a molecule. So let's say you have selected randomly 5 genes. So those 5 genes will be so gene number 5, gene number 6, gene number 10, and gene number 15. and let's say gene number 33, 73. So randomly I've selected these 5 genes. So these 5 genes will be represented as a molecule in this chemical reaction optimization system. So such way, randomly many such molecules will be generated in a reaction mixture. This is a hypothetical reaction mixture. Don't compare it with the actual chemistry. It's all about numbers, mathematics, and algorithms. So such basically these molecules, they represent the potential solution for a given problem. Now all these such random molecules which are generated with different subset of genes, they are allowed to undergo different kinds of chemical transformations. So they can basically react with each other, they can dissociate into separate entities, they can combine. So a lot of actions, as and when they happen in chemical reactions, these will happen. So because of these reactions and interactions, these molecules are going to change continuously. Now every time the molecule is changed, basically the data set of healthy and diseased person, or two different types of cancers, it will be classified with the help of these genes. And the capability of this gene set to differentiate between those two classes of whatever microarray data that we have provided, that will be tested through the accuracy, and that accuracy will be used as a measure of energy of the molecule. And further, the best subset of molecules will be reported, which gives the best classifying accuracy, and that will be then tested further for many other relatedness and etc. So this was a kind of way that we use in order to basically produce a solution for this kind of a problem. Still we are working on interrelatedness and adding some more functionalities of classification as well as multi-class labeling, etc. So basically, that's just one of the example by which for target discovery or target identification, machine learning can be used. Now, coming a little bit closer, like on the closing remarks of these sessions that we are discussing, we'll discuss the questions later. I will keep some time for that. So, summing up, AI and data driven sciences are, of course, evolving very fast and very relevant to this today's day. And of course, they are a very promising field. Now, remember that these are there to augment us, they are not here to replace us. AI cannot replace a medicinal chemist or any researcher in drug discovery, but rather they will augment them with more capabilities and more efficient way of dealing with the problems. It is very important these days that the experts in pharmaceutical industry who understand drugs and targets much better, they should step up and equip themselves with learning these techniques so that they can create much more realistic and more accurate models by imparting their knowledge to the machine and come up with the models which will work in a better way. Of course, these days this is much more accessible. There are so many good and easy to use frameworks available for AI development. There are so many tools for drug discovery. You just need to get involved more into this, testing of these models, validating them, and improving by using some new kind of features and new kind of information that you have from your experimental analysis. Now, as this was intended for essentially the educators or the faculties, just few of the stuff that I would like to say. As long as you have enough data and a problem statement, you definitely can try to use, at least that can be your first step towards getting into this field. Try to use and see if AI can be used at any point. It's important, if you're not familiar with this technique from before, it's important to learn about them at this moment. Even if you see the new educational policies which have been drafted, they have much more focus on the areas like AI or artificial intelligence. In fact, yesterday only our government was part of a very big raise, like the conference kind of, you can say, where our prime minister addressed the importance of AI in the coming days. And this is going to be a part of every stream, not just the life sciences or the drug discovery, but education, industries, automation, quality, every part of our process are going to be automated. So it's important that we equip ourselves with these things and get ready for the near future. For students, it's important for teachers also to get students involved and interested more and more into this. And small interactive sessions or activities through some basic softwares or simple interactive environments like Python, learning those, you can get them involved, share these activities with them and ask them to process or kind of fill them. That will definitely get them more interested into these things, and it can kind of inculcate those interest into those students for going forward. And even for their academic projects, if somebody has the potential, definitely you can encourage them to do the projects based on first the computational data analysis and then the validations through your normal experimentation that you will prepare them or equip them for further. So that's kind of an like all I had to say. But how much time I have, sir?
So 2 3 minutes.
2 3. Okay, then I actually wanted to go through a demonstration, but it will take time. So rather,
Fine,
at this
fine.
point,
If you want, then because second speaker is still not here, so you
Mhm.
can extend to 5 10 minutes. No issue.
Okay, okay, perfect. That's fine. So I'll wrap up with that, and then maybe last 2 3 minutes we can keep for any question answers. So now, just to kind of get you started, if somebody is really interested into getting into these fields and learning more, I would suggest going through some of the important online tools. Uh, One of the tool is GitHub, which is a very good repository if you're not heard of. That's where most of the codes and programs that people write are stored or deposited, and which you can make use for learning. So for example, here I'm sharing a very brief Git repository just to kind of give you a demonstration. So in this code, you don't have to worry about the code at this point. We are not writing a code or developing the software right now, but rather what is important is how we can easily create an environment for learning as well as testing and application. So in this particular notebook, these are called as notebooks, Python notebooks, in which we have these interactive codes. Now this is not written by me, it is available on the GitHub by a very famous YouTube personality called Data Professor, which the channel you should definitely follow if you want to come into the drug discovery and AI together. So Data Professor has a very nice tutorials and videos as well as these kind of notebooks to start learning about the drug discovery and AI together. So definitely follow that. So in this, basically what they have done, just as a project for your initial understanding, you all know the ESOL method of estimating the aqueous solubility. If you have used Swiss ADME or other similar tools, they use this ESOL method to produce or to predict the solubility of this particular molecule. So in this, they have used a similar data set and tried to come up with a better model by using AI based technique. So log S is what we are trying to predict here. So I will just, rather than running completely, maybe I can just go through some of the aspects of it quickly, and then we can take some questions if anybody has. Okay, so in this, basically, simple Python commands can allow you to do a lot more. You just have to take a first step and learn about Python, which is one of the most important learning language for the data science related studies. Again, we have R, we have MATLAB, and many other things are there. But Python has a wide usage and wide support base as well for your things. So let's first download the dataset and look at it very quickly. I'll very quickly do it. Okay, we have downloaded the data set. I'll very quickly just load some of the important stuff which are required here. Now we are just reading this data. Now this is what the original data looks like. It is a data from this particular publication which has a list of molecules with their compound name or ID. They have the measured solubility, experimentally measured solubility value log S, and the predicted. We don't have to worry about the predicted as such. And finally the structure or smiles for this particular molecule. Now in this, what we'll be doing is basically we'll be taking these two columns out, the smiles and the measured solubility. So this will create our data. Our original data will be smiles for a molecule and its experimental thing, because that is what we want to predict. So we'll be showing this data to the training algorithm and it will learn from it. So let's just quickly run through this code. You don't have to worry about it. Just see this smiles have now been extracted from this entire table. Then we will just load the RD kit. RD kit you may have heard of. It's a very good toolkit for different kinds of chemical related information modeling and all. So let's convert this smiles data into the RD kit models. Then the next step will be working with RD kit object. It's just kind of an example, so this step you can just leave. So there are different functions in this model which can get you whatever information you need. So for example, here I have a very simple function, get number of atoms. So when I call this, automatically it will show me in the given compound how many atoms are there. Then we need to estimate or calculate the descriptor by using RDKit or any other method. So here now we will see one of the example as I talked about. We will generate some of the descriptors here. So in this particular method, the author have used a few descriptors which are common and important for this particular thing. We'll see those just going forward. Let me just process these methods. Okay, so in which, as you can see the theory, it is estimated that these particular descriptors, the C log P, molecular weight, RB, that is number of rotatable bonds, are very important for this particular log S calculation, that is solubility. Now these three descriptors are already available in the normal whatever kits that you use, but they thought, okay, what if we can engineer another descriptor which can definitely help, maybe classify it in a much better way. So they created this AP descriptor, that is aromatic proportion. Usually what happens, it gives you the total number of atoms as one descriptor, the number of aromatic atoms as another descriptor. So what will happen if we try another engineered descriptor, let's say AP, which is aromatic proportion, that is number of aromatic atoms divided by total number of heavy atoms. Such kind of descriptors are called as derived descriptors. By using the given two, we derive a new descriptor. So in this case, first three descriptors, log P, molecular weight, and the rotatable bonds, they will be generated from the RDKit directly. Once they are generated from the RDKit, then you can just have a look at them. Now for all the molecules, log P, molecular weight, and number of rotatable bonds are given by the RDKit itself. Now for aromatic proportion, we have to generate by ourselves. So this code automatically does that for us right now. So this you can definitely use as a thing. So here it just shows whether it has the aromatic atoms or not, and then it basically combines it together to calculate for each atom or each molecule how many or what is the proportion of aromatic atoms to aliphatic or normal ones. Then we will just process it. Finally, we will have this another descriptor, which is fourth column or fourth descriptor for a given data, which then we can process further in order to, there are too many molecules actually in this, so we have to, yeah. So finally, we will compute few more descriptors like number of heavy atoms and total, and then combine all of these descriptors into the final table. So I will just directly show you the final table just so that you know how does it look like. So yeah, AP descriptor will be then calculated by dividing those two columns, that is the column of aromatic atoms and the non-aromatic atoms. Finally, we will be combining them together. So let's combine this just by clicking. Now you will see, initially we just had these three columns, molecular weight, log P, and number of rotatable bonds. But by simple command, now we will combine them, the fourth column, into this. So the new data frame that we have will have four columns. Now our data is represented. Each molecule is represented as a set of these four values: log P, mol weight, number of rotatable bonds, and aromatic. So by using these four features, we're going to estimate or create a model for this particular log S and use it to predict it for the new molecules. So let's just go ahead and see this data. We will estimate some of the columns from this. The actual experimental value will first split the data. Is always important whenever you are doing a data science project. The first thing you should always do is split the data randomly into training and testing before you look into the data. Otherwise it causes something that we call as a data snooping bias, which will automatically allow your brain to find some common patterns and accordingly divide the data. So before you actually see the data, you should always split it randomly into training and testing. So training data will be used for model generation and testing will be used for evaluation. Now we are generating a very simple regression model. So let's go ahead and generate it. So for generating a model is extremely simple. Just one line of code, that model is equal to linear model dot regression, and you are just fitting your data, training and data. That is the table that we had provided. That's it. Your model is ready just with two codes. So by learning this Python and related data frames and everything, you will be able to very efficiently work around large data sets and create the necessary models, try out many different techniques at the same time. So this is the model that it has generated. Let's put it under the test. So I'm very quickly running it because we don't have that much of time. And yeah, so that's it. Finally, we have the regression model ready and we can simply test it. Just very quickly, let me draw the plots of the regression. Yeah. So this is the entire. Okay. Okay. We can run all of them together only, but I'm just one by one going. Important steps only I will describe. Yeah. So now we have run the entire on an entire data set. We have run this particular algorithm, and this is the final model that we have. That is log s is equal to 0.26 minus 0.74 into log p minus 0.0066 into molecular weight plus 0.0032 into rotatable bonds minus 0.42 into AP, the new feature that we had added. Now we can basically plot this data and see how well the fitting is there. Just right here into this interactive notebook. So let's plot it. So you can see how well your data is fit into this particular data points, number of chemicals, and very nicely that is the best fit it has found. So this way then you can just study some of the parameters, evaluate the model, and now whenever you have a next unknown compound, you just simply issue a command that model.predict and the smiles for that compound, and it will automatically give you the log s for this. Right. So, okay. So that's all from my side for today. And thank you so much, everyone, for listening patiently for such a long time at stretch. Now, if there are any questions, any doubts, I can take few if time permits and sir allows me to. Let me just go through the.
Thank you very much, sir,
All right.
for your
Yeah. Thank you, sir.
lecture,
Mhm.
describing everything in very simple terminology. Thank you very
Mhm.
much. Just I have one question. Uh,
Yes, sir.
Python program is recognizing smiles because 1 month before I have tried to develop one model. I have converted
Mhm.
that smiles into binary codes once, but I failed in that because it doesn't recognize that binary code because it is predicting
Okay.
same molecules.
Okay. Okay. See, so you are using some kind of a package while doing that, or directly in the
Yeah,
Python you are trying to do?
directly in Python.
Okay.
Not I.
So
I don't have.
by itself, okay, by
I don't have
itself,
any
Python
knowledge
doesn't
of
recognize.
that package are available. That's why.
Okay. Definitely, definitely. So yes, by default, Python will not be able to understand because those are molecules, and the way molecule terminologies are, the Python is just a numerical one. So what we have different packages. So for example, in this case, I was using a package called rdkit. Rdkit is one of the most common chemistry package. So that package allows Python to understand the chemical terminology. So for example, when we give the smiles, so it automatically converts the smiles into the numerical matrix or object that Python can understand. So that's why using this appropriate modules will be much more relevant and useful. But even without that also, we can use some kind of something that we call as a one hot encoding to encode it appropriately into 1010 kind of numbers, the binary numbers.
Okay.
Yeah.
Okay. Uh, Thank you very much, sir. I'll be presenting your e-certificate. Please accept it.
Yeah, thank
Just
you
a
so
second.
much, sir. Thank you for your kind gesture.
Thank you very much, sir, for your time. Thank you. Thank you very much.
Thank you, sir. It was my pleasure. Any other participants has any questions? I don't think so. Okay. All right. Thank you, sir. Thank you so much.
Thank you, sir. Uh, Going ahead with schedule, uh, we have already Dr. VK Moria has already joined us. So I'll be giving I give to my colleague Dr. Pranav Shah to introduce Dr. Dr. VK Moria sir.
Hello. A very good morning to all of you. I welcome all of you to the second day of the FDP on the data driven transformation in drug discovery. It's my proud privilege to introduce all of you the speaker, Dr. V.K. Maurya. He is a well-known figure and needs no introduction. Still, to formally introduce him, he is an alumnus of University of Sagar and presently working as the principal at Government College of Pharmacy, Aurangabad. His broad areas of interest include molecular modeling, nanotechnology, herbal formulation, dental formulations, and chitosan-based formulations. We have been having the privilege of interacting with him on several fronts. He is a teacher par excellence, a great researcher, and a very kind-hearted human being. He teaches all the subjects in a very simple, student-centric manner. He has a grip in all the subjects in the domain, and hence it would be unfair on my part to mention his specialization. He is master in all the branches which we know in the domain or the umbrella of pharmacy and even engineering. I request sir to enlighten us on today's topic, data mining in pharmaceutical research. Meanwhile, I request all the participants to put their mics on and they can ask the questions in the chat box during the session. If there are any questions from the participants, we shall be taking them during the question answer session. Okay. Over to Moria sir.
Hello. Good morning, everyone.
Yeah, sir, you are audible.
Good morning, everyone. Hello, Dr. Bhavin. Good morning.
Good morning, sir.
Good morning, sir.
I feel I am audible.
Yeah, sir, you are audible.
Just now, I was having a very good feast of Dr. Jitesh. He was dealing with the application of Python. So the last segment of it, I could touch. It was really very enlightening. And after this detailed talk on use of Python, I am switching over to my next topic with your permission. That is the computer scientist view of data sciences in drug discovery. So this is just one very overview topic, because when you say drug discovery, most of the pharmacists, they understand that drug discovery means we are looking for the designing of new molecule, which is serving the purpose of certain bioactivity. But in today's industry, the data science has totally changed the picture of drug discovery, which encompasses not only from visualizing the biological aspects of a molecule with the chemistry, we go far beyond it on left-hand side, where data science is being used for synthesis of the drug, and on the other hand, the data science extended the capability of drug discovery and data science to the clinical trials and post-marketing surveillance also. So a good broader view of the total data science in drug discovery practice has been already elaborated to you by Dr. Ajmani. He happens to be one of the first known person to me in the field, where he has involved himself in developing software dealing with the structural designing to the biological assessment of a molecule. Today, I have divided my total talk in two parts. Part one, I will deal with little of the fundamentals of data science, which may be understood by the pharmacist. And second part, I will deal with the data science and its relationship or implications with drug discovery. So, Dr. Bhavin. Hello, Dr. Bhavin. Hello, Dr. Bhavin. Am I audible? Am I audible?
Yes, yes,
Huh. So, is it okay? Is it okay? This domain is okay?
Yeah, sir. Yeah, sir. You are audible.
Okay.
Yeah, yeah. Please go ahead.
So, in today's world of data, if we look around us, we come to know that data generation which is there is crossing every limit. And this one statistics I got from internet that around us, due to digital infrastructures, almost all 294 billion emails are sent every day. On Twitter, it is 230 million tweets are done, and Google search, if they are crossing 1 billion Google search per day. These are the kind of electronic transitions which are taking place across the world. And now, if we look to the storage capacities of data on memories which are available in different form, so comparing from 1956, where our devices were capable to store only 2 digital photos, now in 2020, both devices are capable to store 12 million digital photographs. Such a huge leap is there. But beyond this, the digital data which are stored worldwide, if you see the period of only 2 years, that is 2018 to 2020. So in 2018, the total amount of the data which is stored was around 4.4 zettabyte. But within 2020, this volume of the data has been raised to 44 zettabyte. So you can just imagine the kind of the data the world is generating. Merely in 2 years, it is increased by tenfold, which has virtually crossed the limit of Moore's law, which was the fundamental of data science. So such type of the huge data generation has put us in the sea of data. Around us, in every form, data is there. Our today's topic is data science in drug discovery. So the question is this: which data is pertaining to be useful in the area of drug discovery? This drug discovery is a field to which we feel you have a disease, and for the treatment of this disease, you try to find out a suitable molecule which can be designed, synthesized, formulated, and marketed in the least number of days by following all regulatory aspects, keeping now the consideration of intellectual property right. This is what the coverage of drug discovery in pharma industry today. Now looking to this, we come to know that what kind of the people are needed for this drug discovery project. Whether you need a chemist, whether you need a pharmacologist, whether you need a person who can understand its physicochemical property, you need a person who can formulate it, you need a person who can manufacture it, who can market it, who can see the clinical aspect of it, and so on and so forth. But everywhere, the problem is one, that this process, unless and until, is not communicating the information from every segment, we do not find that adequate result will be obtained in a time-bound manner. If the time has to be reduced in drug discovery project, which is directly impacting the cost of drug discovery, then data management becomes one of the very key points. And that becomes the basis of today's talk. So looking back to the point where Dr. Ajmani has left the discussion of drug discovery cycle, and every one of us is aware that what is the drug discovery cycle. In this case, I will just have a brief overview so that I can correlate my lecture here. So drug discovery cycle begins with compound collections. This compound collection can be the result of synthesis of the new molecule. It can be the result of existing molecules which can be tested for repurposing of it, or they can come altogether from the source which have never been exploited for the molecule as a drug. So you have the compound depository. These compounds are tested by the methods which are known as HTP methods, which are in vitro methods. In vitro methods, there are several techniques, and these several techniques are based upon the available targets. Now, this target in itself is a big area. Once you come to know that the compound has the activity, you can put them for the secondary assays. But this input for primary assay can be obtained from chemical synthesis. Now, chemical synthesis is the result of the design of the molecule. And design of the molecule, backward integration, it gives the idea that it is due to the structural characterization of drug binding with certain ligands, which is the result of lead compounds from SAR study. And this SAR study is again the result of the primary assays of compounds which have been collected. So we are finding in drug discovery process, we have a cycle. And this cycle is very interesting. In this cycle, the feed of new compounds are always there. And this feed of new compound goes in a cycle, and this cycle is providing new and newer type of the activity of existing as well as the new molecule. Once these primary assays are done, then secondary assays are done in other phases of clinical trial. In these secondary assays, you try to find out the refinement of biological activity and PK/PD studies. In the PK/PD studies, we are now focusing more on toxicity and metabolic studies. And once these PK/PD, BAB, these toxicity studies are done, then we filter out those compounds to find out a good clinical candidate. And once a good clinical candidate is obtained, this clinical candidate is subjected to the filing of the molecule for the purpose of manufacturing and marketing. This is what a drug discovery cycle is there. And every time we are finding that there is no place where the drug molecule, claimed drug molecule or claimed molecule is not rejected. So although due to the rationalization of drug discovery tools, we are in a position to decrease the number of failure, but still number of failures are there, that we synthesize the compound and a good number of compound, they goes out of being a good clinical candidates of the future. This is causing the cost to the company as well as the time involvement in drug discovery process. Now, obviously the question comes that what is the reason that despite of applying so many type of the technology, still we are not in a position to ensure 100% that if a drug molecule is there, we can say with affirmativeness that the molecule is if a potential candidate as a drug or not. Still the chances of failures are there. So the simple question is that probably we are not able to establish the relationship of the chemistry of a molecule with the biological requirement of the molecule. So we are looking the chemistry of molecule with biological requirement in pieces, and hence we say that in drug discovery project, still our situation is like the four blind men who are trying to describe the elephant, and whatever organ they touch, they feel elephant is like that. So they make certain error. Sometimes it clicks, so the molecule becomes a potential drug. Many times it does not click, so you find that it goes out of the total project. But whatsoever it is, this is the question of prediction. So as in other branches, prediction has got its own limitations. Prediction has the limitation in drug discovery process also. But in the total process of drug discovery cycle, there is no question that our ability to generate data has been increased in an immense way. For example, if you have a compound, now earlier the compound to which a chemist wants to write, he used to write in a manner to which only a chemist can understand. For example, our teacher teaches that what is the ethanol. So our 9th or 10th class student says that ethanol is CH3CH2OH. It is one of the way to describe ethanol molecule on paper to understand that what is its composition. So ethanol, a scientist by IUPAC name gives a name to it, and this name becomes one of the international standard to put in the record. But when you do it, then if I write it that it is the ethyl alcohol, then the question comes that whether writing ethanol as ethyl alcohol is serving any purpose to find out what kind of the biological activity it will have. And the question is, the answer is that no, it does not have. Unless or until the name is given in the form of a processable information, this particular information is no value for the professional work. So as a result, there are many things which have come forward. Ethanol has been turned to ethyl alcohol. Ethyl alcohol has been represented as CH3CH2OH. Then CH3CH2OH has been made converted in the form of certain properties of the molecule. As we know, carbon has the atomic weight of 12 and hydrogen is 1, oxygen has 16. Then we say that using this structure, we are able to calculate the molecular weight of that material. And if the molecular weight has got certain correlations with the properties of molecule, like its boiling point, its melting point, then we can say that certain parameters can become the correlates from the property. This is what Dr. Jitesh was talking right now, and we have coined a word. That word is known as descriptor. The world of descriptor in itself is a very big world, which is unending and will remain unending, and it depends on the creativity and possibility of the nature to incorporate the compound properties of the molecule with the activities of the molecule. But that has become other end to calculate descriptors in different form. But calculation of descriptor requires the basis to represent a structure. Representing a structure in the form of C2H5OH may not help in many other time, and hence the scientists have come up with a single line notation process. That can we write the chemical structure in a single line, and as a result, the smile notation came into picture. Now we can see the known important compounds which are available. One of the document is Merck index. This Merck index is having the pages more than thousands. So looking to the Mercandax and its description in 1,000 pages, it forces us to think, can a human brain assimilate this kind of the information so fast and accurately? Then the answer becomes no. So what is the way for it? So they say that, why don't we make a table? On one side, you write a name and you write the name in the form of a smile code. So instead of writing CH3CH2OH, if I write as CCO by ignoring all H's, then we can say to this simple C, we can allot certain attributes. Simple O, we can allot certain attributes. And assuming that how many H will be required to satisfy the valency, we can allow the attributes of H. These attributes may be many. They may be the atomic volume, they may be the atom radius, and so on and so forth, electronegativity. So if I have the smile notation of a compound, my storage space of the name of the compound is reduced a lot. And if I have certain method by which reading the smile and calculating the property, this thing I just try to develop, then probably for any molecule of which I have the smile, I can calculate that property. So simple thing is that my primary data is collected in the form of a smile code. And if smile code data is collected, my total Mercandax is reduced to few pages only. So this is how this becomes a technique of data science for reducing the data bulk. Reducing the data bulk not only saves the space, but it also enhances the processing speed. Using this, if these compounds are tested in the laboratory for in vitro test, again I will generate certain data, and these data will be the assay results. Assay results will be in the form of a table. If the assay results will be in the form of a table, then again you have compound and its activity in quantitative number. A big table will be generated. So we know that the 96 well plate technique, in that you put the compound and then you try to find out where the binding is taking place and where the binding is not taking place. So you can find out the binding coefficient also. So huge data is generated. So either you take the numbers from 96 well plate, or what you can do, that instead of generating the number from the well plate, you capture the image of the well plate, and now you don't have the result in the form of a big table, but this table has been reduced to a very small image to which I can compress. So the data or few MB can be reduced back to few KB. And this image, I can keep it as the stored assay results of all compounds of which I am knowing the smile. And this image, now I can process back by the technique of image processing to find out what compound with what target has got how much of the binding. So a reverse engineering is also always been possible. And for that, I need not to store the result in quantitative manner. So the image analysis becomes one of the tool for processing my assay results from well plates or in vitro assay. At the same time, we have a very interesting world that the compounds are coming from synthetic route also, this loop to which I have talked. This loop is entirely different loop, which is relatively newer from this loop what we have studied here. The first one was from the hit and trial process. Whatever existing molecules are there, or from plant or any other source you are getting, for them it was there. So the second loop is the result of the human brain, which is thought that when we have tested enough number of compound and we came to know that this compound has got certain activity and this compound doesn't have the activity. So can we find out what structural feature of these compound are responsible for activity? So we filter out the compounds which are having activity and the compounds which are not having the activity. So the compounds which are having the activity, then we ask them at what level they are having the activity. We quantify their activity and the science is known as the QSAR. So all those compounds which bear certain activity are referred as lead compounds. And these lead compounds generates the data which are known as QSAR data. So QSAR data are generated on the principle of the concept given by Gould, which was originally applied for the determination of properties of organic compound, where the science was developed as QSPR. Now in biology, this science has been renamed as QSAR. Now, in the QSAR, again, you get the data in the form of a table. You have a compound. Now you have certain parameters of those compounds which are referred as descriptor. This descriptor may be as simple as number of carbon atom. It can be as simple as number of aromatic bonds. This can be as simple as hydrogen bond inside the molecule, or it can be as complex as ellipticity of the molecule, or the polar surface area or non-polar surface area, or the ratio of these two descriptors. So we say that descriptor may be fundamental or descriptor may be a derived descriptor. So as on today, we are having few thousand descriptor possible of a compound. So such type of the descriptor, you generate a C. The number of descriptors are much more than the number of compound. Now the question is this, all this data are not useful. Now you have to find out which data of all QSAR data is useful. So we enter into the science of statistics to find out association or regression. In the regression, what we try to do, we try to find out which descriptors are really dictating the biological activity. And when we know it, we select the compound according to that. What we say, we try to find out what are the structural characteristics which are responsible for binding of a molecule with the targets or receptor. This binding of the molecule with biological molecule will result in identifying the limited number of biological molecules where large molecules of synthetic origin can bind in less or more quantity or affinity. This binding with biological molecule may be responsible for biological effect. Simultaneously, it may also be responsible for toxicity of the drug. So those shape generations in biological molecule is just simple as finding out what is the design of the lock with the design of the key. So design of the lock does not mean that we want to know the whole design of the lock, but we want to know what kind of the levers are present there. Those shape of the lever are either pharmacophore or they are toxicophore. Once we identify them, then we can see that which molecule is fitting to what extent. And on that basis, even though if we do not design the molecule, we do not synthesize the molecule, we can hypothetically design the molecule and we can see the fit. And once on the basis of theoretical study in this loop, we have those hypothetical molecule, we subject them to chemical synthesis. Now the question is this, chemical synthesis till now is a world which was filled with good chemists, a very long range of different type of the reactions. And these reactions are depending on the intuition of the chemist, that what raw material will be used and with what catalyst or with what I will be able to convert it into the target molecule. But in this process of hit and trial or based on the intuition of the chemist, we faced many problems, and these problems are ever growing. For example, you all of a sudden come to know that whatever starting material for a drug product you have taken, this starting material is having the intellectual property right of some country, and in your country it is not available. So if it is not available, the meaning is that you are depending on that country. The present situation we have faced in case of few antiviral drugs, where more than 60% of the raw material was provided by China, and now we find that it is very difficult to produce those drugs in India because China is not supplying those intermediates. Unfortunately, synthesizing those intermediate in India is suffering from a problem that we do not have the routes by which in time-bound manner economically we can produce those intermediates. So that's why we are dependent on them. So the question is that whether designing a synthesis of chemical molecule is more tedious than designing the molecule of biological activity. A totally new question I am posing upon you. The moment you try to think about it, for a pharmacist, a new area begins. That can we develop certain strategies in which the synthesis design can be done? To some extent, the attempts have been done, but still, even the world is in a very premature stage. So this is giving us large number of database of chemical reactions, because these reactions are not only generated by organic chemistry, but more key reactions are generated by biological chemistry. So the area of biotechnology is making its way here. And the moment area of microbiotechnology is making its way, then you are connected with the fermentation science. And when you are connected to the fermentation science, you are connected with microorganisms. They are bacteria and fungi. And the moment you are connected to the bacteria and fungi, you are connected with the genomes. So, drug discovery project at the early stage, which was considered to be very negligible, now it is having one of the future connectivity from the genome project itself. So initially the genome project was considered to be important from human genome project, which was done for different type of the purposes, but now it is linked here, simultaneously it is linked here. So one total project has got the connectivity here. We will see that it is not that simple to connect the project, genome project here. Now we are having the connectivity of this project here, because the gene is produced by DNA, then definitely the role of all nucleic acid is there. Nucleic acids are produced by the help of several enzymes. These enzymes are again produced by DNA and RNA. So nucleic acid and protein production, they goes hand in hand. So when nucleic acid and protein productions goes hand in hand, the meaning is that you generate nucleic acid database and then you generate the protein database. The moment protein database is made, then you have several other connectivity of those protein database, to which we will see in due course of the time in little depth. But looking to this total drug discovery cycle, we come to know that As such, drug discovery cycle was involving so many technocrats, right from organic chemist, analytical chemist, biochemist, computer scientist, pharmacologist, animal experimentation purpose, the doctors, hospitals, and so on and so forth. We come to know that everyone's vision is different and everyone is generating the data in a very, very different manner. In fact, all these data are interconnected. The structure is getting connected with assay is getting connected with the genome, this is connected to the secondary genome. So we are not merely data generating machines. Everyone is not merely a data generating machine. Unless and until we do not utilize these data for the benefit of the task to which we want to do, then it is just like a mathematics book to which the teacher gives us and says that solve the numerical. And when we solve those numerical, our exams are over and things are over. So it is not like that. We have to learn the technique in which the data to which you are generating, they should be organized well. They should be stored well. If you organize them, stored well, the meaning is that you should try to give them to the others, because data to which you generate may not be of your value, but the data to which you have generated, it may be the value for the others. So you should try to give the data to them. But the moment you try to give the data to them, then it becomes the task of talking to them. It may happen that two people who are talking, one is knowing English and another is knowing Chinese. So one is providing the data in one language and other is not accustomed with that language, then that data becomes useless. He may not be in a position to utilize that data. And that's the reason that even we pharmacists, we are talking so much of the drug design, hardly we are aware that how BLAST can be used for drug discovery project, because the language of the BLAST is entirely different. So the people who have created the BLAST database, if they do not make the fundamentals similar to the database of creating SMILE, two database may not have the sync, and these database will be useless. So somewhere at some platform, all the people who are working with different type of the database, they have to come to a consensus that we will talk only in this sense. So drug discovery cycle or drug discovery projects are simple, but unless and until a data scientist does not help you to organize, to plan, to manipulate, to analyze, to infer these data, drug discovery project can never be a successful one. And I want to congratulate all organizers of this program that they have touched this aspect which is otherwise not touched by the people. Okay? So now, little I want to talk about the data. Hello, Bhavin, our coordinator. Hello, anyone can go on unmute?
Yes, sir. Ketan here.
Ketan.
Yes, sir.
Whether I am going in a right way?
Yes, you are very much audible and going in right way.
I don't
and with
know
right
what
speed
others
as well.
have talked.
With right speed as well. Yes, sir.
Okay. So now I want to tell you that in drug discovery project, the theme is data. If the theme is data, then what is the data? So data is any information which is generated either in silico or in the laboratory. Sometimes this data may have a number, or many of the time it may not be a number. For example, if I have a database of 10,000 compounds, in 10,000 compound, the data structure is having two parts. One part is the SMILE, which is representing the structure of the compound. this smile code is in the form of a text. On the second side, I may have the images which do not have either the letter or the number. It is just they are the photographs. In third column, I may have purely the numbers. These numbers may be 550, less than 4, more than 50, like that. In fifth column, I may have the data something like this. The activity is there or not, yes or no, yes or no. Okay. So I mean to say the data may be of two types. So data may be of three types mainly. This data may be either a number. The number has the beauty that you can mathematically manipulate them. You can perform certain algebraic operations on it. Second type of the data to which you have, they are the text type or string type, where you cannot manipulate. If I have written Ajay, the meaning is that it is simply Ajay. No more meaning can be given to it. So if I have Ajay and I have the Kunal, at the most I can do that. I can put Ajay and after that I can put Kunal, because alphabetically K comes later. But it does not mean anything if I put Kunal below or Kunal up, because I have to use only one word that I am putting data in ascending order or descending order, something like that. But this thing cannot be done even for the picture. If I have the data in the form of a picture, then I cannot say that sort them in ascending order or descending order. So if I have the chemical diagram of 100 compounds, can we sort them? Then the answer is definitely no. So data are having varieties. They have their own nature. They have their own problem. But human mind understand that data can always be converted in the form of a table. This is how we have learnt to make a good table in Excel. So in Excel, you have many columns. Every column has got a column header. In different type of the different column header, you put different type of the information, and as a result, you make a table. This table we create in drug discovery project at every level. This every level means, say for example, I am putting the smile code and melting point. Smile code, molecular volume. So tables are made. But smile code and melting point has got one column that is a quantitative one melting point. But it can have a problem that some compound doesn't have the melting point. They do not melt and they decompose at certain temperature. So in that case, we put the dash. If we put the dash, then we cannot say that we are dealing with the number. And in processing of those data, I will have a problem. So what I try to do that I try to divide the table in two. The table one, I put the compounds which are having the melting point and the compounds which do not have the melting point. But ultimately, these two tables are giving rise to the same property of the molecule, that is the melting point and chemical structure. This is just one simple example. It can be extended to a big one where we add more and more parameters. So in Excel, we have a field that you have worksheet 1, then below it you have a worksheet 2, and below that you have the worksheet 3, and so on and so forth. So if every worksheet is a table, then more than one table makes workbook. So you might have seen that Excel makes workbook. One Excel worksheet makes table, but more than one Excel worksheet makes workbook. This workbook is in the direction of a database, where from 2 dimension, I am adding one more dimension to it. So I make a database. If I am making a database, then I can have a database in many ways. I can have a database of a chemical compound in relation to its physical property. Then I can have the database of chemical structure with its biological property. So I have one chemical database and I have another biological database. If these two I try to merge, then common point is structure of the compound only. One database is giving you chemical, physicochemical property, and another database is giving you the biological property. So when I try to connect several tables, I make database. When I try to connect several databases, I make data bank. So data bank is higher hierarchy of managing the data. If I have a data bank, then these data banks should be connected with each other. As I have made a connection here, that common thing is chemical structure in these two. But this does not help much unless and until I try to find what is the relationship of chemical structure with the biology. So this the physicochemical structure with biology may have many connections like that. So I generate a network. So the next phase is generation of the network. This knowledge network generated by one system can be connected with the network of other system by some other place which has been developed, and I make the network library. So this depends on the extent of sharing the data to the outside world. Actually, every data is generated and organized in the form of a table, but they travel the distance up to library. Unless and until you do not convert the tables up to library, they cannot be used by a different fraternity. But this journey is not that easy. This journey is equally problematic as the journey of drug discovery project. So data science plays a great role in streamlining these things, in solving the problems of data collection, data cleaning, data organizing, data analyzing, and connectivity associations. Then we have organized information which can be used now for professional purpose. So first target of data science is this. Then data science has been extrapolated to the professional people's activity, and in drug discovery, that activity is the finding associations. This finding association is done by our brain, and we have learned a very big contribution of Corwin Hodge, that he said if a molecule is having the biological activity, preferably it should have one or more connectivity of physicochemical property with lipophilicity of the molecule. And then he says it is log P. So if the lipophilicity is there, then the answer is quite obvious. You always remember that the science, if it does not communicate hand to hand with the philosophy, no theory or no science is good. So we should think that why biological activity should be connected to log P. The answer is simple. For biological activity, the drug has to cross the membrane. All membranes are lipophilic. So if the log P is not favorable, drug molecule will not cross it, and hence it is not possible to absorb the molecule by the body. So at first stage it will be failed. Log P is required at other place also, but primarily we should think. Then second thing he says that it should have the association with hydrophilicity or electronic parameter. Reason is simple. Before the drug goes to the biological environment, it should be soluble in water. If it is not soluble in water, no drug molecule can be good. So that's why electronic environment will give you the idea about water solubility of a compound. Third thing is it that it should have The hysteric parameter in favor. Hysteric parameter is quite easy to understand that unless and until the space to which a drug molecule is acquiring, if it is not in favor of the space which is available at target, it cannot go there and fit there. So unless and until the combination of these three parameters are not there, then no drug will have the bioactivity at all. Now, looking to this simple logic, the library of network try to search the structural feature with the databases of biological parameters as well as the physicochemical parameter and try to calculate the correlations among them. If good correlations are there, then it is likely that qualitatively you can say that the activity is there, and that becomes the basis of SAR. But SAR can tell you it is associated or not. But when you couple it with the number, correlation science has to be escalated to the next level of analysis. That level of analysis is the regression. So this regression says that what is the quantification of correlation? In what way two things are associated? Whether they are associated in a positive manner or they are associated in negative manner, and to what quantum. So degree of associativeness we try to find in regression, and quantitative associative relationship we try to get. Now these relationships can be many. These relationships can be linear and they can be non-linear. The moment you say they are non-linear, then infinite number of possibilities are there which are beyond the human brain. Here the data scientist is needed. He tells, I can help you to find out which level of relationship you should trust and where you should not trust. So that gives rise to the next technique of regression. The end of the regression technique is in the form of an equation. That mathematical equation, which is the result of regression, is known as mathematical model. Just on the previous talk using Python, you might have seen that Dr. Jiten has created a model. This mathematical model gives you the relationship among the variables, and this relationship is involving certain numbers, what we say coefficients. The value of coefficients indicates you that which parameter is how much important. And after that, you have to test the validity of this model. If this is valid, you can use it for predictions. So this is the domain of data and data sciences. Once you think of the data, then automatically many issues arises. First is data safety. What about the data safety? The data to which you are getting, how safe they are. If they are not safe, then disaster can take place. Okay. Second point is the efficiency. If the data storage it is not done in efficient manner, then there will be several problems. You can understand that imagine that to a bank you are transacting. To a bank, if you are transacting and you have made a transaction to a party, that much amount at the same time should be debited from your account. So if it is debited from your account, it is taking the time of 10 minutes. And in the meantime, some other person transacts to your account, then which account should be preferred? So there should be sequencing. If the time slice is not maintained to the lowest level and safety is not taken that unless until previous transaction has been made, then there will be problems with the balance. The same thing happens when you work in a team. One team generates certain data, second team utilizes those data, and they try to update your data with their data. If this is not done in sequences, then with the speed, then total mismatch of database content will be there, and hence you need speed of the data. And this speed of the data, you understand, we in normal computer we talk in kbps, then mbps, okay, while in supercomputer we use the unit flops. So speed is one of the area where the data scientist will definitely help you. It is not like that. Some people say that everything can be done in Excel. Fine, everything can be done in Excel. But you try to do Excel with the big database, you will come to know that even on good computer, to open that workbook, it may require the time of 30 to 40 minutes. It is not possible. So such type of the small tools cannot be used for big projects. The next thing should be cost effectiveness. If my drug discovery data are not cost effective, then probably the industry would not like to use them. To tell you very frankly, in pharmaceutical industry, the big data, this buzzword, is not very much preferred even now. The reason is that storage cost of this data is very, very huge. In fact, we cannot have the storage of this data, because storage of this data requires huge space. So they need server. And when you need server, then the question comes of data safety. So if you, many of the time our computer gets crashed, in that time, what will you do? So the server have to be mirrored. So you have one server and simultaneously your data is backed up on another server. So when you do the mirroring, the meaning is that simultaneous posting of the data should be there among more than one mirror, so that every time the content will remain the same. So the meaning is that storage cost becomes double. So different type of the memories have come. So many agencies, they have started to keep their server, and they say that we don't do any other business except to provide the storage space to you. So big players are like Google is there, and nowadays to everyone, the company which has surpassed as Amazon. Amazon, they provide server to everyone. Virtually on today, they are providing server to Google also, because maintaining these servers are very expensive thing. They require cooling, they require special softwares and like that. But in this total process, how much is the reliability of transaction of information is there, that has to be checked all the time. So if you are making any transaction with the data, my data posted at 2 or more places, are they same or not? That I do not know. So the reliability testing requires different kind of the protocol. So this protocol has to be tested and designed in a very meticulous manner. Then, looking to this all thing, we come to know that the total process of data storage and management becomes too tedious, which is not possible for others. But end user want convenience. So these data scientists, they should provide the front end to which the real user want to use it, and they find that it is convenient. So for example, if I am working with a genome project, then genome project interface should not be in the form of many digits and all. I'll expose you a little to that, so you can understand that what is the actual meaning of front end. So these front ends are designed by data scientists to provide convenience to the actual end user. Simultaneously, this front end prohibits actual user to tamper or to touch the serious data, core data. So for that, front end designing becomes a separate thing. And last thing is security. Your data is always susceptible for the damage by the people knowingly or unknowingly. So there should be the security. One of the simple security you have that the password. Password is not a good kind of security. Then you have got fingerprint and so many things. So security aspect of the data is one of the key point where the data scientist really helps you. Hello. Hello.
Yes, sir.
Bhavin, just I want to know what is the time of the first session I can keep?
Okay. Just I'll get back to you, sir. You continue, please, sir.
No, after I will make a paradigm shift after that. That's what I want to do.
Okay. Okay. Just hold on, sir. I am telling you. So right now up to 1 p.m.
Right now up to 1 p.m. Okay.
Okay. Then we will meet after lunch at 2 p.m.
Okay, it doesn't matter. So up to 1 p.m. I can continue with this. Okay.
Yes. Yes. 20 minutes are left. 20.
Yes. I will try to finish the first part in
Okay.
20 minutes. Okay.
Okay. Okay. Thank you, sir.
One of the common database which is of our use and most of you have used it, that is the NLM database, that is National Library of Medicines. Actually, it is not a database. I should not say it is a database. It is basically a data bank, and it is more than that now, the network of data bank. So this network of data bank is having one database which is known as Entrace database. On this you can click very easily and browser Entrace database and you can come to know. Entrace database is basically the set of many other database. Okay. H5N1, you are understanding, I feel. Hello.
Yes.
This is
Virus.
It's a virus.
Virus.
So you can see that a simple virus, how many records are there? Worldwide, whatever researches are going on H5N1, the number of entries in Entrace database in the form of literature are given by this graph. Okay, this is a Pareto chart. So you can understand the x-axis of this database is the logarithm of number of records. How many records are there? So log, you can understand when we say log 5, log 1 means it is 10, 100, 1000, 10,000 and 1 lakh. So if you see different database like protein database, geoprofile database, Newcorp database, PMC, these are different databases for different purposes. PubMed is one, PCSA is one. So how many books are there on that? All these records are there. Now these records which are available only in one database, that is the Entrace database of H5N1. So you can understand the amount of the information which has been stored in this single NLM Entrace database. So in such a huge database, if you want to find out the information of your interest, it is something like searching the needle in a haystack. So the thing is that it is not only essential to keep on storing information in database, it is not only enough to link those database, it is simultaneously essential to generate tools which can help you in searching the information of your interest. Now, the right side of it, one very good graph I have got from NLM library, which is part of PubMed and all. So you can see year-wise. I don't want to explain the whole graph, but the important thing to which a drug discovery scientist should understand that how the needs are changing and different tools are provided by a data scientist. In 1990, the BLAST has been created. BLAST is one of the database which was giving you the information about protein sequencing and all of microorganism or different type of the living body. 1990. Then came the Entrace database. Then came the gene bank. You can see gene bank. Once the gene bank project, which was initiated in 1992, it was finished in 1995. Genome project. So I remember, because I have seen I have seen the time when BLAST was created, and at the time people were talking about genome project. So in my lab, when I was working with certain small molecular modeling, so people were thinking that genome project will be likely to be over by 2020. The reason was that the computational infrastructure and storage capacity was so less that people can never imagine that DNA sequencing of human gene can ever be over in coming years. The technology was so poor. So this was projected to 2020, but you can see in reality, this genome project was over in 1995. So thanks to data scientists and thanks to computer people, that they have created such a wonderful setup or infrastructure where the biologists have got this opportunity to think it further. So then OMIM project is started, which was further in 1997, a very prestigious project by NLM has been created, that was a PubMed. PubMed, that time the declaration was done that all biological information about a chemical compound should be in open domain and they cannot be kept secret. So they became the part of PubMed. So the whole literature was available to the world. And ultimately, the completion of human genome was there in 1999, this one. It was a milestone, human genome project. When human genome project was completed, now whole genome was sequenced. Now the question was that if the human genome is sequenced, what to do to that? How can I get the benefit from human genome? So a discussion erupted rather, I say, worldwide, whether genome information should be disclosed or not. The moment you disclose the genome information, it can be used for both purposes. It can be used for damages. It can be used for creativity. Now, we know today that apprehension was not wrong. I don't know what is the truth today, but the coronavirus, I don't know whether it is the result of some genome study or not. That is the thing to which the future will tell us. So people have started understanding genome by a tool. So biological to all these tools which have been developed here, they were coupled and they made compatible with human genome, and the project came, that is the PubMed Central. PubMed Central was a project which was having everything of exploring genome from biologist point of view. And at that time, people have said that can this genome project be used for understanding the proteins developed in human body? Out of these proteins, few will be enzymes and few of them will be the drug targets. And that time, the initiation of drug discovery project actually started in scientific manner by developing QSAR and all. And then it was thought that this biological information which was available in PubMed should be coupled with the chemical information of drug molecules, and hence an attempt has been made to generate a different network, that is the PubChem network. Now this PubChem network was giving the idea about every possible molecule which can be of therapeutic or toxicological value. And this information came worldwide in a public access. Then genome-wide studies were compiled with reference to these chemicals. And then worldwide it was thought a genome should be stored in data form in a platform which should be uniform throughout the world. So a consortium has been formed, and this consortium has got the main purpose of standardizing the data which will become the part of genome, and they are linking backward to the chemicals or human studies. Now, forget 2020, you can understand even in 210, more than 1,000 genomes have been completed, and many more are on the verge of completion of that. So you can understand that the kind of data scientist activity, they are more than the activities which were predicted, and that gave more pressure to the people to find out the accurate way so that biological information can be seen in a normal way. And there, large number of commercial activities have been started. This is a public domain activity. Apart from that, many, to be very frank, more of the commercial activities have been imparted than the charity activity. So many commercial database have been developed. One of the example is the TRIP. Those who have used it, I don't know. This TRIP database is very much used to the people in the clinic, especially my PharmD friends. They can have it. And this TRIP database is basically the databases of clinical trials. Clinical trials are closely associated with the drug discovery projects. If clinical trial database has not been seen in drug discovery projects, then the pitfalls in new molecules will be more than ever. So TRIP database is actually the evidence-based database is there. So whatever clinical trials are done, their primary research, they are there. So presently they are, you can see 650,000 trial data is there, and this data has been summarized. TRIP is important because of the reason that it merely does not give you the trial profile. It gives you their expert commentaries also. And these commentaries are there in the form of answers. So very many clinical people, they ask the questions, and these questions are professionally answered as we have FAQ and all. And such type of the answers have been converted to another database, and in that the total number of entries are more than 7,500 entries are there. Now these 7,500 entries actually related to the grade A evidence-based journals. You can see the number: Evidence Update, NIHR Signals, Lancet, JAMA, BMJ, Internal Medicine Annals. So more than 40,000 primary researches have been the part of this. And from primary research and from key primary research, these clinical questions are generated and they are answered. And simultaneously, secondary evidences are also taken into account. From primary research, many secondary evidences are seen. First category of secondary evidences are systematic reviews. Systematic reviews, those who are really working in the field of medicine, they can understand that the Cochrane review, they are really marvelous, which are giving the concise informations about any clinical question or any medicine. Okay, now they just see the number of data number of repository which are there, 150,000. Then certain synopses are there which are evidence based. These synopses are there, that is they are coming from different disciplines, like from pediatric people, from clinical people, and so on and so forth. So 25,000 plus synopses are there. After reviewing these, the expert doctors or therapeutic persons, they generate clinical guidelines. For example, COVID started, in case of COVID started, many clinical trials are going on to save the patient, and those data are shared. So the apex people, they make the guidelines how to treat it, and rest of the people, they treat on the basis of those guidelines. We see those guidelines as the COVID guidelines provided by WHO or every country. There are more than 50,000. Such guidelines are available for almost all every disease, TB, malaria, and all. And then this is also supplemented with regulatory guidance. These regulatory guidance are most important for drug discovery project. So this is just, I gave you one of the very small idea of hundreds and thousands of different databases which are there and which have been generated on the simple concept of data, data to table, table to database, database to data bank, database to data bank to network, and network to the library. Henceforth, this discussion will be continued in that fashion only. So let me conclude here that data science, we will say, actually it is a data driven science. So data driven science, we will say that what it is the use of different scientific methods. It is using the processes, it is using the algorithms as well as system. And the purpose of is this, to extract knowledge, to find out insight. Okay. Now this insight has to be seen in light of the target information. What is the target information I am having? I have the data. The meaning is that I am having the knowledge. If the knowledge is there, it is coming from the source, which is information. So basically every person who is working, they are generating information. Information to a rational people think and convert them into the knowledge. And when this knowledge is generated, we convert it to the wisdom. So data science is basically the science of creating wisdom, where we apply the techniques by which the patterns can be explored, or the hidden things which are there, they can be explored the way our brain works. Say for example, if I have different kind of the pen, the brain will always tell that it is a pen, but irrespective of its color, irrespective of its ink, irrespective of whether it is a gel pen or ball pen or ink pen, they will name it as a pen. This is known as abstractive nature of the brain. Still, brain retains a capacity to differentiate the things. If many pens are there, brain will differentiate them, that it is a red pen, it is a blue pen, it is a green pen. So the meaning is that, actually speaking, data science must have the two-way traffic. From large chunk of data, go for comprehension, and from comprehension, you go for large chunk of data back. If any part is missing, then you will make error, and then predictions will be wrong. So we will say that in short, we can say that it is data science is about finding and exploring data in real world, and then using the knowledge to solve practical problems. If practical problems are there, there is no point in solving them. For example, if you just try to see that we have a biometric machine. In biometric machine, people say that you put the finger and it will identify the person. So the logic is very simple, that by putting the finger, the image of your fingerprints are captured, and once the image is captured, then with the standard image it is compared, and then say you are that person or not. But people are very clever, they put Quora. Quora is one of the platform which is very interesting to find out such debate. People say that if I make a replica of my finger and if I put it, then will it recognize it? So the thing is that, yes, it should recognize, because if you are recognizing fingerprint, then it should recognize you by in this way. So the fraud can be there. Same with, then again, this has given rise to the data scientists. So the data capturing technique you try to change. Rather than capturing the data merely by fingerprint, you try to capture it by capacitance measure. So type of the sensor has to be changed, and then whatever data you are getting, you can't do the fraud. But still, some people say that by force, if I keep someone, or it is causing COVID, a new question arises. So they say, don't put finger, show the face. So face recognition system came. So as the real world problem comes, then data science has got their own solutions of them. So it is ever growing one. So data science is applied to the whose primary role is to design and create process for the complex as well as large scale data set. The data science is not useful for a small scale data set unless and until you do not have a huge data set. There is no point in using data science. So large scale data set, nowadays a new word is being coined, that is the big data, about which I will little talk in the second session. But data science does not mean only the collection, it needs processing. More important is cleaning. Unfortunately, raw data are coming in a very dirty form, so they require to be cleaned. Then you have to verify and you have to check their integrity. So processing, cleaning, verification, and checking of integrity of the data, then analyzing them. Don't begin analysis unless and until these steps are over. And once you analyze them, then begin with the predictive modeling. And then you can go to machine learning. This point I will try to cover in the second session. So Bhavin, Ketan, Mr. Pratik Patel, I don't know, I am sorry if I am using the wrong name, I could not get it. Coordinator?
Okay. Hello, sir. I am Dr. Pranav Shah.
Sorry, Pranav Saji, I am sorry, I could not get the name. Henceforth, I remember. So I feel my time 1 o'clock is over.
It's okay, sir. Your talk is always interesting, so we never look at the clock.
Okay. No, the thing is that not like that. I want to continue, but I got my own slight health issue, so I want to have a little break.
Yeah, sir. Definitely, so, we'll break for half an hour and we'll start the next. Sorry, we'll break for 1 hour and we'll start the next session.
Okay.
At 2 p.m. Sir, can we take the questions now of this session or at the end?
Bilkul, why not? That's why I have taken the rest because I want to answer the questions of this session here itself.
Okay, so
in second session you cannot ask. Whatever the information or wisdom I have, I will try to answer. Please, welcome.
Okay, dear participants, those who have any questions, they can unmute and they can ask because none of you have posted any question in the chat box. So if you have any questions, then you can unmute and then you can ask directly to respected Maurya sir.
You can definitely ask.
Any questions from the participants? Okay, sir, it seems that all the participants have understood the concept and right now they don't have any questions.
Hello, Dr. Shah.
Sir.
Hello, Dr. Shah. Just I want to know one thing, that whether the thing to which I am talking, there can be only two issues. One issue may be there that either someone has already talked about it, or second may be that this may not have any relevance with the participants who are there.
नहीं sir, ऐसा नहीं है. You have created a base और अभी people. हाँ sir. Hello. 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 Hello.
Hello. Yes. Just actually speaking, I am not knowing the participants what kind of the background they are having. So I may have some problem in narrating few of the concept. Either in too detail or too short. So people might not have much interest into it. So can you brief me who are the participants?
Sir, Bhavini,
Hello, Bhavi.
mainly all participants are 90% are from pharmacy background and these are from mathematics, chemistry, maths, English, like that.
Okay, okay. So,
Mostly is from pharmacy background.
okay, okay. So do you feel that I am going in a right way, or should I change the
Yes,
way?
sir. Yes, sir. No, no, sir.
Okay, okay. Okay, thank you very much. Thank you very much. So we will make
Okay.
at 2 o'clock.
2
Yeah,
o'clock.
sir.
Ah,
2 o'clock will be. Give us
okay,
some
okay, okay. Will do. Thank you very much.
Thanks, sir.
Okay, thank you very much.
All participants will be meeting at. Thank you.
Thank you, sir.
चलो, मेरा क्या है?